Interrupt this program for breaking news from the Global National Newsroom.
Hello, I'm Robin Gill. We're standing by with the Prime Minister set to make a rare Saturday address to Canadians. Justin Trudeau has spoken each day now for 6 days in a row as Canada and the world deal with the COVID-19 pandemic. Justin Trudeau is in self-isolation at his home. He says his wife, Sophie, is doing well after testing positive for COVID-19. We're expecting the Prime Minister to address the border issue. It's the first time we'll hear from him since the Canada-U.S. border closed down all non-essential travel at midnight Eastern Time. The border remains open for trade, so trucks carrying food and goods can still cross. Canadians returning from the U.S. will also be allowed back into the country, but like anyone else coming home from abroad, they will have to self-isolate for 14 days. There are now more than 280,000 reported cases of COVID-19 around the world and more than 11,000 deaths. Those numbers rise by the minute. In Canada, at least 12 people have now died from the virus. There's also a Canadian who died in Japan after traveling on the Diamond Princess cruise ship. There are now more than 1,000 known cases of COVID-19. 11,000 cases of COVID-19 in Canada. That includes at least 11 who have recovered. More than 78,000 people in this country have been tested for the severe respiratory illness caused by the new coronavirus. The bulk of cases are in BC, Ontario, Alberta, and Quebec. As of this morning, Ontario has the highest number of cases right now with 377, followed by BC with 348 cases. Alberta has 195 cases, and there are 139 in Quebec. I should clarify that there are more than 1,000 cases. Now, every province has detected the virus. There are no confirmed cases in the 3 territories, but officials there have joined every province, except Nova Scotia, in declaring either a public health emergency or a state of emergency. Now, these declarations mean different things depending on the region, but generally, overall, they give officials more power to protect the public. Yesterday, Saskatchewan announced that anyone in the province who violates self-isolation orders will be fined $2,000. In Quebec, a woman who tested positive for COVID-19 was arrested after she violated a quarantine order by going out for a walk. Now, as we wait for the Prime Minister to speak, let's go to our chief political correspondent, David Akin, in Ottawa. David, update us on the border issues.
Right. So the border, of course, was closed overnight to all non-essential travel. And there is still going to be some discussion exactly what that means. We did hear, of course, from our colleague Jackson Prosco reporting on Global National last night that so far as the U.S. is concerned, that doesn't mean you can't cross the border for healthcare reasons if there are students attending institutions. And of course, all truck drivers, so vital right now to be carrying back all those goods and services that go back and forth across the border. Remember, it's about $3.9 billion a year. A lot of our food supply comes from the United States. They need a lot of manufacturing equipment for their supply chain. So truck drivers coming back and forth are not obligated to go into 14-day quarantine. They need to keep going to work. But right now, there's more monitoring of their health as they're coming across. They're getting the questions about their health. How are they doing? Any symptoms? So I mean, we're just hours into this, and we'll see how it goes. But right now, it's all new at the border.
How long is this expected to last? I think it was initially 30 days.
Well, I think we're going to review things on March the 30th, and in 30 days, you're quite right. And there's a whole bunch of prohibitions right now. You were talking a minute ago about some of the emergency powers that all provinces except Nova Scotia have given themselves. And those are significant powers. We shouldn't say just because it's the provincial emergency power. They have significant powers in addition to fining people, jailing people if people aren't obeying quarantines. Provinces also have the power to compel industries to produce certain items. The provinces have those powers. We may see at some point where the federal government wants to assert its emergency powers. And that may be, we've heard from the Prime Minister, nothing's off the table. But all of those powers also come with a sunset, a window. They are meant to be temporary. So those will expire at some point. So, you know, Prime Minister Trudeau has been asked about this just about every day of the week. You've been watching it, Rob, and he keeps saying, how long are we going to have to do the social distancing thing? How long are we going to have to be in these lockdown modes? And his answer right now has been, you know, it's probably going to be weeks, if not months.
Yesterday, the Prime Minister talked about how he has been talking with airlines to bring stranded Canadians back home. Where are we at with that? Right.
So the big sort of checkpoint this weekend would be some Canadians in Morocco, in West Africa. So I'm going to get my west and east right. So there is one flight of Canadians leaving from Morocco today, or leaving this weekend. Not sure if it's today or it will be tomorrow. So we're going to be watching that. Earlier this morning, our Foreign Affairs Minister, Francois-Philippe Champagne, spoke with some Foreign Affairs ministers from about half a dozen countries around the world. And again, the topic of conversation there is how to get everybody's expats back home. And again, going to our reporting from our friend Mike Armstrong on Global National last night, it's a little complicated situation. Plane A may travel to Morocco with some Moroccans, then it picks up some Canadians and comes to Canada. There may be some people who are Americans and they stay on the plane and go to the United States. So there's a sort of milk run of planes going around the globe, picking up expats, dropping them off in the appropriate country. Remember, right now, foreign nationals can transit through Canada, but they cannot stay here in Canada. So if they arrive on a plane, remember there's only 4 airports right now that are accepting overseas flights. If those foreign nationals arrive at, say, Vancouver International or at Pearson, they can stay on the plane or transfer to another plane as it moves on to another destination, but they may not disembark and stay here in the country.
David, do we have a sense of how many Canadians are stuck abroad and where they are?
No, and again, that's if there's been any criticism of the government is perhaps providing a little more granular details on not only that, but say on medical equipment needed in different parts of the country. If we could get a daily update. Some other countries, South Korea, for example, were doing something along those inventory. We do know that on just about any given day, there's about 3 million Canadians, think about it, 3 million Canadians who are outside the country. That may be where their work is. For example, I'll use a personal example. I've got a brother who's the head of a school in Spain. He's not coming back to Canada. He has professional responsibilities in Spain. So that's when I say that 3 million number is we're talking about people like my brother who are going to probably stay where they are because of their professional or personal responsibilities. So the exact number that we're trying to repatriate, difficult to say. There also was the issue, remember, Robin, earlier this week where the Prime Minister was asked, what about Canadians who waited too long to come back or might have been a little irresponsible and, in fact, may now be a cost to the taxpayer because there is loans out there right now for Canadians abroad to try and get home. The Prime Minister, I think, making an important distinction, saying right now, the government of Canada is not about judging people, it's about helping people. And I think about that because you may remember as well, Robin, in 2006, when the Israel-Lebanon war was going on, there were a lot of Canadians in Lebanon at the time, and the Canadian government had to sort of extract them. I happened to be on the Prime Minister's plane in Europe at the time, and he ditched all of us, and he flew the Prime Minister's plane down to Lebanon, filled it up with a couple hundred Canadians, and came home. And there was a discussion at that time, should the Canadian taxpayer foot the bill to essentially extract Canadians when they ought to have done so themselves. That government didn't even quibble and spent the millions it took to get Canadians out of harm's way. And the current government is taking the same approach. It's not going to ask why were you there or why didn't you come back earlier or why this or why not. Let's get Canadians who need some help, the help they need, and get them back in the country.
I do remember that. Thank you very much, David. We're going to go to Jackson Prosco now. He's in Washington. He is our Washington bureau chief. Jackson, the border closures will obviously have a big impact on the U.S. as well. Guide us through that.
Yeah, Robin, I think what's interesting is that after the agreement was reached between Canada and the U.S. then started working with Mexico so that they were essentially implementing the same policies on both their northern and southern borders at the exact same time. And so the situation here in the U.S. is almost identical to what we're seeing in Canada in terms of restrictions at the border on non-essential travel, but still allowing provisions for people who need to come in for work. And I think that's important because when you look specifically at the agricultural sector here in the U.S., there are a lot of workers who cross into the U.S., especially on a seasonal basis, to help with harvesting crops and food distribution here in the U.S., and a lot of that moves up the chain and into Canada as well. So it really was important for all three countries to be on the same page in terms of the restrictions they were talking about. They have also, though, here in the U.S., really used this as an opportunity to sort of implement some of Donald Trump's policies with respect to the border and migrants. Specifically, they are now, like Canada, saying they will turn away asylum seekers and migrants who try and cross the border border illegally, who try and cross in between border crossings, they will send them back to the country from which they came. That, of course, is something that Donald Trump has been trying to do for years. Since assuming the presidency, he's now using this crisis to be able to do it. And yesterday, during the White House briefing, they essentially made the point that they feel that mass migration, uncontrolled mass migration, could be a vector for further virus spread. Now, I should point out in saying that the numbers of people crossing the U.S. border illegally from Mexico are roughly in line with what they've been in past years. There's not some sudden surge taking place, but Donald Trump is essentially trying to blend those two issues under the guise of the broader health and safety border closures that we're seeing both Canada and Mexico now undertake right now, Robin.
Jackson, let's talk about the patchwork of lockdowns in various parts of the U.S. We saw California is doing it. We see that New York is doing it, and there's been some municipal levels. Can you guide us through that?
Illinois also joining that list yesterday. I think what's really interesting and perhaps alarming here in the U.S., though, is it is, like you said, a complete patchwork. Take a look at Florida, for example, where the governor was really wary of shutting things down because, of course, last week was spring break for college students here in the U.S. That's a big money-making time for hotels and resorts. You probably saw that footage of the beaches absolutely crowded. And so what you saw in Florida were county by county or city by city orders to shut things down, but not a broader statewide order coming into effect, at least not until this coming Monday when spring break is over. That's just one example. Texas has faced heavy criticism for having been very late to bring about restrictions on bars and restaurants, even as some individual cities did that as well. And I believe it is Kentucky that has given almost no guidance whatsoever when it comes to shutting things down. So that gives you a sense of the patchwork and why you're hearing some governors and some mayors and some county executives come forward and say there needs to be directed federal action and coordination. The CDC has put out guidelines over the course of the last week. They've been flexible. They've been changing along with what we've seen from many municipalities, but they are simply guidelines. They're not orders at this point. And the White House has rejected any suggestion of doing a national lockdown as of right now. They're saying it's simply not needed. Part of the reason they're saying that is because they're saying in Middle America, generally speaking, you've got far fewer cases. You've got hotspots like New York State and California, but Middle America not seeing any. West Virginia just recorded its first case this week. On the flip side, though, Robin, people in West Virginia are saying they've got virtually no ability to test for this. So how do they know what the situation is actually like right now? So I think that gives you a sense, Robin, as to why there have been so many cries for coordinated federal directives about what cities and states should do.
When you listen to the Trump administration, it sounds like the president is just leaving it in the governor's hands.
He really is. He had a call with the governors earlier this week. I believe all of them were on the call. But state by state, they're making their own calls. We've heard New York's governor, Andrew Cuomo, come out time and time again and essentially use his platform to plead with the federal government to do more, to step up production of masks and emergency supplies, to step forward with the Army Corps of Engineers to build temporary field hospitals. The White House says it's listening, but they haven't necessarily stepped forward with any action. And in fact, it's unclear as to whether they have, as the president has claimed, used the Defense Act that they've invoked in recent days to get automakers, for example, to shift production to make ventilators. These are all things they say they're going to do. States are begging them to do it, but it's not clear that it's happening with sort of the speed that many states are hoping for right now.
Jackson, here in Canada, for example, Saskatchewan, Newfoundland and Labrador, they're enforcing fines if you are not in self-isolation, if you're not quarantining, if businesses are not following protocol. What are the enforcement measures in the U.S.?
Again, it's a jurisdiction by jurisdiction basis. Some states are talking about essentially making it a misdemeanor, so a fine if you're caught out and about. States are being more proactive when it comes to forcing businesses to shut down. That seems to be where a lot of their emphasis is right now. And so you're seeing local and state health authorities essentially move in and tell businesses that refuse to close that they will use other measures such as the Health Act to enforce closures. In fact, we saw something along those lines here in Washington, D.C., where a group that owns a number of restaurants and bars refused the initial order from the city's mayor to essentially shut things down and enforce social distancing. And they got the health department involved and used those powers to shut things down. But it's not at the point yet of what you're seeing in some Canadian provinces.
Thank you for that, Jackson. We are going to go to the Prime Minister now in Ottawa. He's about to give his Saturday address. Let's listen in. Let's take a look at him. He's standing at the door of his cottage right now. There we go. Oh, minor technical problem here.
Good morning, everyone. Bonjour tout le monde. I want to begin by recognizing that even though it's Saturday, there are people across the country who are on the job. Whether you're a hospital staff or a first responder, a bus driver, whether you're hospital staff or a first responder, a bus driver, truck driver, or freight train operator, I know you're working harder than ever right now. So thank you. You're making a real difference for people who need you. I want you to know that we see that, and we're standing behind you. Whatever our government can do to support you, to keep you safe, to protect our economy, we're doing everything we can to make it happen. And that includes for northern communities. We're working with partners to reduce travel to northern communities to help protect them from the virus. Today, the Northwest Territories will issue an order to limit non-essential travel into the territory. We support this important step. At the same time, we're focused on ensuring essential goods get to people in these communities. We will continue to work with partners and stakeholders on travel to the north. This past week, we also announced new measures to put more money in people's pockets to get through this uncertain time. This means everything from boosting the Canada Child Benefit to increasing the GST credit to giving people a break from paying back their student loans. We've unveiled a plan to mobilize industry to produce things like masks and ventilators. And to accelerate vital research, $25 million will go to teams across the country working on measures to detect, manage, and reduce the spread of COVID-19. For Canadians who are overseas, we're sending them texts with important information. We've announced new funding to help people borrow up to $5,000 to return to Canada or to cover their needs while waiting to come home. And public servants are working around the clock to help people who are stranded. On that last front, we've continued to make progress in the last few days. Aujourd'hui,
Today, I'm announcing that our government is working with Canadian Airlines to make commercial flights more accessible to Canadians who are stuck abroad. We're also working with other countries to make sure that our airlines have the necessary permits and logistic measures necessary to actually allow these flights to take off. A first Air Canada flight will leave Morocco at the weekend. We're working with our airlines as well to reach similar agreements. We're planning other flights over the coming dates, potentially from Spain and Peru, with other countries being announced as quickly as possible. Several factors have been taken into account when we decide where flights will leave from. For example, the number of Canadians in specific areas of the world, the closure of airspace, or the local situation as well. We will not be able to reach everyone, but we will do everything we can to help as many people as possible. Now, for the government to be able to contact people who need help as quickly as possible, all those abroad must register with Foreign Affairs if they have not already done so. You can do it online at travel.gc.ca. The same health policies that apply to those people coming into Canada will also apply to these flights. All passengers on these flights will have to go into self-isolation for 14 days when they get back to Canada. I'd also like to remind you that if you have symptoms of COVID-19, you cannot get on the plane. Our goal here is to protect your health and the health of your loved ones as well, so it's crucial that everyone does their part.
We're working with Canadian Airlines to make commercial flights available for as many Canadians who are stranded as possible. We will also be working with other countries to ensure that our airlines have the permissions and other supports necessary to fly. The first flight is leaving Morocco this weekend and is being operated by Air Canada. We're currently working with other airlines on similar arrangements. And there will be more flights from other locations in the coming days. This potentially includes Peru and Spain. Other countries will be announced as soon as possible. As we make these decisions, factors like the number of Canadians there, airspace closures, and the local situation are being taken into account. Now, we won't be able to reach everyone, but we're going to do our best to help those we can. To make sure we can get information to people as quickly as possible, all Canadians overseas should register with Global Affairs Canada if they've not already done so. You can do this by going online to travel.gc.ca. The same public health policies will apply to these flights as to anyone else who's coming into the country. Everyone on these flights has to isolate for 14 days once they're back. I also want to remind everyone that if you're showing symptoms of COVID-19, you won't be able to board. This is about keeping all Canadians safe, so we need everyone to do their part. On that note, I want to recognize the airlines that are working with us to get travelers home and families reunited. And I especially want to thank the staff, from pilots to air crews, for their professionalism and dedication. During a very difficult time for the industry, when people are worried about their jobs and futures, they're still stepping up to help. This has been a tough week for a lot of Canadians. People are concerned about their health and the economy. And today, on the International Day for the Elimination of Racial Discrimination, let's not forget that people are worried about how fear can fuel racism, too. So let's be kind to each other. And let's stand up against discrimination wherever you see it. In the days and weeks ahead, as we continue to feel the impacts of this virus, it will be more important than ever to fight against fear, misinformation, and stigma. We must continue to pull together, because in times of need, our strength is defined by how we care for each other, as neighbors, as communities, and as a country. Même pendant la fin de semaine, on doit tous faire notre part.
Even during the weekend, we have to continue to be vigilant. We must continue to follow the recommendations from our public health agencies and limit to a maximum the travel we do. Perhaps you'll miss not going to the restaurant with your family or not going to the movie theaters with your friends. But to protect yourself, we must all make adjustments. We must look after each other as well. That's crucial, because it's together that we'll get through this very tough period. Thank you very much.
Hi, Prime Minister. Molly Thomas from CTV National News. I saw today that the Foreign Affairs Minister has spoken to officials in Australia, Brazil, Germany, Peru, and Turkey. You mentioned Spain as well. For Canadians that are outside of maybe more populated areas or places that we're talking to, is it safer for them to stay put? They are scared and they're asking us, I mean, should we stay? Should we avoid those airports? Should we avoid places of getting trapped in another country en route?
I think everyone needs to take the best decisions for them. Obviously, if they are not certain they're going to be getting on a flight, they're probably better to stay in place. But Global Affairs Canada will give recommendations like that on various situations. People will need to use their best judgment. We're doing everything we can to help as many people as possible. But as I said, airspace closures that different countries are putting in, logistical challenges, these are things that we're dealing with right now as a world. Okay. Évidemment, nous voulons que les Canadiens.
Well, of course, we want Canadians do everything in their power to stay safe and healthy. They'll have to judge based on their particular circumstances. I would recommend that they don't go to the airport if you're not confirmed on one of these flights. But Global Affairs Canada will share more information with you to make sure that Canadians are able to make the right choice for themselves to keep themselves safe and healthy.
Man lost his life. He wasn't tested for the virus until he was put into ICU. He only came back positive after he had died. I mean, we know that there's community spread. Should we not be testing people beyond just those with travel histories here?
The ramping up of testing is increasing at a tremendous pace. Tens of thousands more people are being tested every single day. We are getting more equipment for testing. We recognize that broad-scale testing is an essential tool in continuing to fight the spread of this disease. And as I said, every single day we are doing far more tests than the day before, and that will continue to ramp up. We
recognize that testing is an essential tool for us to deal with the spread of this virus. This is why every day we're testing tens of thousands of extra people, and this increases to grow every day. We know that testing, mass testing, is one of the best ways of protecting Canadians and of reducing the spread of the virus as well.
I wanted to ask about the Emergencies Act. Speed is critical in containing this virus. We've seen what happens when countries wait too long to restrict people's movement. Polite requests only go so far. Why not declare a federal state of emergency now and get ahead of where this is going?
I want to thank the millions upon millions of Canadians who have self-isolated, who are engaged in social distancing. That is the fundamental thing that we all can do and need to do to prevent the spread of this virus. We know that in many global crises or situations, individuals feel powerful to make a difference, powerless to make a difference. In this situation, people can affect their health, the health of their neighbors, by taking straightforward steps to self-isolate wherever possible, and to move and to keep social distancing to a maximum. We have not removed from the table any options. We're looking at a broad array of measures that we can move forward with. At this time, we do not see the Federal Emergencies Act as an essential tool today, but we are continuing to look at the situation, and we'll make decisions based on the best recommendations of science.
And what do you need to see before declaring a federal emergency?
I think the key issue is, are there things that we need to be able to do as a government that we cannot do with the very strong existing regulations that are in place and that our government has as tools? Okay. Well,
of course, I'd like to first of all thank the millions of Canadians who are following the recommendations of our public health agencies to the letter, who are practicing social distancing, working from home, etc. These are things that we can all do, not just to deal with the global crisis, but also to keep ourselves and our loved ones healthy. We're also looking at the Federal Emergencies Act as well, but we don't think that this time it's necessary to invoke that act because we already have the tools to do everything that science is recommending we do today, but nothing is off the table, in fact, for the future. Christian Noël, French CBC. For those Canadians who want to come back to Canada, you're organizing air bridges. Who's paying for these flights? Will it be clients, passengers who will pay, and will the government make sure that there's no gouging by the airlines? That's right. We're working with the airlines currently to make sure that the prices being paid by passengers are responsible and appropriate for those flights. We're there, of course, to help the airline, if necessary, to cover their costs for these flights, if necessary. But we do expect that those Canadians who have to come back pay for their own tickets.
We have worked out we're working out an agreement with airline companies where the government will help to cover extra costs, but we expect Canadians being returned home on these emergency flights to pay a responsible ticket price for their return.
Now, the
pandemic seems to originate in the live markets in China. This is the third time since SARS and H1N1. Could Canada use its vote or its presence at the UN to ask that China actually crack down and eliminate these markets? Well, I think that over the coming months and years, we'll be learning a lot on this pandemic. We'll learn how it actually started and how we can actually stop it happening again in the future. For the time being, all our efforts are focused on protecting people today, tomorrow, and in the future, and to make sure that we're able to resolve the health care or the health emergency for Canadians. Then after it's over, there will be discussions to have about how to stop future pandemics of this type.
Minister, you've said it's inevitable that there are going to be Canadians stranded abroad. What is your message to those Canadians who are scared? They're in countries where the medical system is not like it is here in Canada. There are towns under lockdown with heavy military presence. They're afraid they could be stuck there for months. What do you tell them and their families?
First of all, Canada is making consular assistance available, a loan of $5,000, for example, to help them in either buying tickets home or being able to hunker down in place. It is an extremely difficult situation, but the lockdowns of various countries, the limits on air travel, logistical capacities of our airlines means that we are unlikely to be able to bring everyone home. So we're going to ask people to stay safe, to make smart choices, and do the best they can in a situation that is unprecedented, exceptional, and very difficult.
And what's the level of cooperation that you perceive from Canadian commercial airlines to try to repatriate Canadians? And as well, what bailout is on the way for them?
I have spoken directly with the heads of Canada's largest airlines over the past days, and I can tell you that they are all in terms of supporting Canadians, in terms of getting people home. There are, of course, limits to what we can all do to rescue everyone, but I can assure you that the airlines have been very positive, thoughtful partners on that, and we recognize that Canada's airline industry has been strong and successful in years past, and will need to be strong and successful once this pandemic follows its course and we come out the other side. We will be there to support airlines and other industries that have been sorely hit by this particular crisis.
Thank you. We'll now go to the phone lines for a few questions. Moderator.
Thank you. Please press star 1 if you have a question. Faites étoile 1 pour toute question. The first question, la première question est de Lina Dib, Presse Canadienne. Please go ahead. Your line is now open.
Bonjour, Monsieur Trudeau.
Hello, Mr. Trudeau. Earlier this week, Mr. Legault was advising Quebecers to stay in their own regions. Newfoundland is stopping Canadian travellers coming to Newfoundland. The Northwest Territory is doing the same thing. Even if you have not decided to order everyone to stay at home, are you prepared to recommend that people don't travel domestically? Well, we recommend that Canadians stop travelling unless it's essential. We're recommending that people stay at home, that they don't go and see their neighbours. That applies to the U.S. It also applies to the provinces and territories as well. Now, there are people who have important reasons to travel for family, for business, but if people are able to keep their travel to a minimum and stay at home as much as possible, that'll be a good thing for everyone.
We're asking people to stay home as much as possible, to avoid non-essential travel. And that means not going to see your neighbors if you don't have to. And that applies to the United States, but it also applies to other provinces. We recognize that people have reasons, whether family reasons or work reasons or other important reasons to travel, and they can make those judgments. But as much as possible, people should be staying home. People should be self-isolating with their family members so we can all get through this, and so we can be making sure we're keeping our healthcare professionals and our healthcare system safe and able to handle the capacity.
Thank you. Next question, moderator.
Thank you. Merci. The next question is from Greg Quinn from Market News. Please go ahead. Your line is now open.
Good morning. Bank of Montreal and Scotiabank have said the deficit this year could come in at around $100 billion, about twice the previous record. Have you seen any official figures from government of those kinds of numbers? And do you have any kind of hesitation politically or economically about that kind of figure?
We've heard a wide range of estimates from economists and banks about how bad this is going to get. The only thing they seem to agree on is that it's going to get very bad. Fortunately, Canada is an extremely strong fiscal position. We have one of the lowest debt to GDP ratios, the lowest debt as a factor of the size of our economy of most of our allied countries, and that gives us room to inject money into people's pockets, into the economy as necessary. We will focus on ensuring that Canadians and companies get through this difficult time so that once we're through, we can pick up where we left off and continue to have a strong and prosperous economy. This is what we're focusing on right now, how to bridge Canadians and businesses through this difficult time. We have the capacity to do that, and we will do what is necessary.
Thank you. Last question, moderator.
Thank you. We have a question from Mia Rapson from the Canadian Press. Please go ahead. Your line is now open.
Good morning, Prime Minister. I'm wondering if you could talk a little bit about the capacity of the civil service to deliver things like employment insurance. We saw record numbers of people applying for EI this week and lots of people saying they couldn't get through on the phones, they don't know how to apply. How, with everybody working at home or so many working from home and so many applications, is the government going to be able to manage this?
We recognize that we need to do things that are absolutely unprecedented in terms of getting money out the door into the pockets of Canadians who need it. We have many different programs and many different tools that are designed to do that in normal times. In these exceptional, uncertain times, we're having to take new measures and create new measures to be able to deliver for Canadians who need it right now. Our civil servants are working extraordinarily hard to ensure that's possible, but it's not just about delivering existing programs to far more people. It's about actually simplifying both the process around application and delivery to be able to get money to the people who need it in this exceptional circumstance. I want to thank all public servants, not just at the federal level, but at provincial levels as well, who are working incredibly hard, many of them from home, to ensure that we're able to hold on as a country as we get through these difficult times. We will continue to use various measures in order to get money out to people through many of the things that we have in place already, but we're also looking at new things, and the civil service is an essential part of flowing that. Merci beaucoup tout le monde.
On a rare Saturday address, let's bring back David Akin in Ottawa. David, the Prime Minister says it's inevitable that Canadians who are stuck abroad are going to be stuck.
He did say that they're working very hard, of course, and Foreign Minister Champagne was talking to some of his counterparts in a variety of countries where there are Canadians, but there's the international aviation system right now is a bit of a jumble. There are some countries which have closed their airspace, some countries where they just don't have air traffic controllers. You couldn't land a plane, you couldn't take one off. And so, as the Prime Minister said, there are going to be some Canadians who wished to have come home. The government's standing ready to help them come home, but they're just going to be unable to get home for a certain period because of some of these restrictions with the international aviation system. That said, some good news about the folks in Morocco. A plane will be taking off tomorrow. Air Canada just put this out on Air Canada's social feed. So if you're interested in this particular flight that is going to leave from Casablanca, Morocco, Sunday, that is a plane of Canadians that's going to come out from there and land in Montreal. So there's some good news on that front. The Prime Minister also saying today that naming two other countries where they think they may be able to get something going, to get some Canadians out, Spain and Peru. And of course, Spain is, after Italy, Spain is the second hardest hit right now in Europe. There's a national state of emergency there, so there'll be many Canadians who'd like to get back to Canada. Could see some flights there. And we know that in Peru's been one of these situations where literally it's been just difficult to get any planes off the ground or landing. So the Prime Minister, and we've heard from some of those Canadians in Peru, and now there may be some good news on that front. But again, as you're right to say, there's going to be some Canadians who are going to be stuck abroad, even though they might want to come home, even though the government of Canada might want to try to get them home. And that's just a function of restrictions right now across our international aviation system.
The Prime Minister mentioned that it would be country by country basis and that it would be a new country announced just about every day. Let's talk about price gouging. There are concerns about the airlines price gouging. We've had viewers email us and call us about that. What's he saying about that?
Right. Well, this is something that, I mean, it's right now a matter of persuasion, trying to get airlines to do the right thing. Airlines obviously are trying to cover costs. I mean, major airlines know that if they are seen to be profiteering here, there's going to be a bounce back on them. We've seen that with some consumer products companies trying to raise prices. They're going to get in a world of hurt with a public relations backlash. But there are some legislative tools that provinces could use. They have some powers on that, and certainly the federal government does, should it come to that.
David, every day the Prime Minister is asked about invoking the Emergencies Act. Why is he hesitant?
There's a couple of things. First of all, we know, and we talked about this just before we went on air here, is every province but Nova Scotia has invoked their version of the Provincial Emergencies Act. And under that, those provincial powers, they are very significant, and they range from everything from obviously fining and jailing people who ignore certain orders about where to go or where not to go. Companies can be fined if they're disobeying certain orders made by a public health official. Provinces can order companies to start making equipment. That's what provinces can do. Now, the federal government has very similar powers. A couple of things. The federal government, first of all, has to determine that the emergency surpasses the capacity of any one province to deal with. Who knows? We may be getting to that point. The federal government must consult with provinces before declaring a federal emergency. The federal government only has a limited number of things it can do. There's nothing in the federal act that says, you know, we can do this, that, and this, and anything else we want. There's no blank check. So, for example, the federal government has no power under the Emergencies Act to track Canadians using cell phones, for example. We know that was something that was done in China to enforce a quarantine. There's no such emergency. There's no such thing as martial law in Canada. It doesn't exist. Yes, we can request our army provide some backup and help, but there's nothing along those lines. Also, under the Federal Emergencies Act, the Parliament must be recalled within 7 days. So if the Prime Minister is considering invoking this Emergency Act, there has to be a provision that legislators can get back here to Ottawa to sit in the House of Commons. They'd have to debate on it and vote on it within 7 days. There would be logistical issues. There would be health issues, health issues for the House of Commons. But the Prime Minister saying, ready, it's all on the table. One thing that is in the Emergencies Act that the federal government may wish to consider, and this was news today, is limiting the ability of people to travel between regions of Canada. We have not seen any interprovincial barriers to movement until today, and we saw the first one. It was the first thing the PM said, that the Northwest Territories, which has no cases right now, the Northwest Territories is now banning all but non-essential visits into the territory, and it is supported by the federal government on that. Again, that is the only one that I'm aware of right now where there's a ban into territory. But the federal government certainly has that ability under the Emergencies Act to tell Canadians, right, that's it, nobody's going to, for example, Prince Edward Island or the island of Newfoundland, or, for example, traveling to northwestern Ontario, in different regions of the country. That would be a power that the federal government may consider, and it would have to invoke the Emergencies Act in order to have that regulation.
That's likely a strategy to protect the Indigenous communities that are in those northern territories and northern parts of the province.
Absolutely, and those, as we've heard earlier this week, Indigenous communities, First Nations, Métis, Inuit, are among the most at-risk populations, primarily because in the communities they live in, they tend to be densely packed, and there is not the healthcare supports in those communities that we find, obviously, in some parts of southern and urban Canada.
One of the questions that was directed at the Prime Minister is that the Bank of Montreal is projecting a $100 billion deficit. The Prime Minister seemed realistic about us being in the red.
Yes, and I've read the same Bank of Montreal reports, and I speak to their chief economist, Doug Porter. He's one of the more bearish of the Bay Street Bank economists in terms of how bad this is going to be. But even Doug Porter, again, being among the bearish ones, says that $100 billion is still something we can afford. And I know politicians have been arguing for the last 4 or 5 years on the left and the right that we shouldn't have had any deficit going into this crisis to give us all the fiscal firepower we need. The deficit was going to be about $30 billion this year before this started. If we start spending $70 billion more, even $100 billion more, I think most economists believe Canada is in a position to do that. Provincial governments, it may be a slightly different story, and that's where we get into some discussion about fiscal health in the country. The government of Newfoundland and Labrador, we should point out, depends heavily on oil revenues for its treasury, and it was in terrible financial shape, so much so that some suggest it could somewhere down the line, these are business reporters saying this, not economists, saying that it will have to worry about avoiding a bankruptcy. And if a province goes bankrupt, it's the federal government that has to backstop a province. So to sum that up, federal government's okay fiscal capacity-wise. There may be some concerns at some point down the line about the fiscal capacity of provinces, who, of course, are the ones paying for healthcare systems right now.
But you could say that the certain businesses are getting a boost with the demand for things like masks, hand sanitizer, swabs. That is helping to boost our economy to a degree.
Absolutely. Take a look at Walmart. Walmart's saying it needs 10,000 people to manage stores. Grocery store chains are ready to hire temporary workers. They need people to stock shelves overnight, not just act as cashiers, but get that supply system working. So absolutely, there's going to be some shifts in sort of economic opportunities, but it's happening very rapidly and very drastically, and that, of course, is what is going to throw so many people out of work, we hope temporarily, looking for these EI benefits, those incredible claims of last week, 500,000 claims for EI in 1 week, wow. But you're right, there's going to be, we hope, some people say, okay, well, I'm not working as a server at a restaurant, but my local Walmart or grocery store may need some assistance in getting food out the door, and hopefully the market will match up people who need employees with people who are looking for a job.
As always, thank you for your insight, David. We're going to go back to Jackson Prosco in Washington. Jackson, you're watching some alarming developments coming out of New York State.
Yeah, Robin, a grim milestone being surpassed here in the United States just moments ago as New York State revealed new numbers. Now more than 10,000 confirmed cases just in New York State. 6,200 of those cases are in New York City. The hospitalization rate, and this gives you a picture of the crisis that is looming here. 15% of those patients are ending up in hospital right now. That is actually down slightly. The surge in numbers really is not so much a function of the virus spread as it is a demonstration of the increase in the number of tests that are being performed in this country. But at the same time, we've also had an alarming report out in the Washington Post while Prime Minister Trudeau was speaking. It says, quote, health officials in New York, California, and other hard-hit parts of the country are restricting coronavirus testing to healthcare workers and people who are hospitalized, saying the battle to contain the virus is lost. In other words, Robin, it is likely so widespread that they are saying if you only have mild symptoms, a fever, a cough, constricted breathing that does not require hospitalization, stay home. You will not qualify for a test at this point.
What kind of support is New York getting from the federal level?
We've heard New York's Governor Andrew Cuomo asking repeatedly for federal government intervention. Specifically, they said they want the Army Corps of Engineers to come and start building field hospitals in the state. It's not clear what the White House response to that is going to be. We'll have a White House briefing in just a couple hours from now. I can tell you, though, New York has mobilized its National Guard. It's also looking at converting large convention centers in Manhattan into field hospitals, along with other facilities at the same time. One thing the state has flat out rejected, though, is the idea of a complete lockdown, a shelter-in-place order like we've seen in California. The governor saying that's simply not feasible, not realistic. Instead, they're simply ordering all non-essential businesses to shut down. 100% of the non-essential workforce has been told to work from home. But these are all state-level measures. Again, there's an open plea from the governor for more federal intervention from Washington.
What about the military? What about the Navy? Anything along those lines?
At this point, the Navy is mobilizing 2 hospital ships, one going to each coast. It's not clear where the West Coast ship is destined for, whether that will be Los Angeles or Seattle. On the East Coast, the military hospital ship that was promised is supposed to head New York, but it's currently in harbor, actually undergoing repairs in Virginia, and won't be able to sail until later into April. At this point, the way they're considering using these hospital ships is actually more as traditional hospitals for people who don't have coronavirus, to keep them from overloading the existing hospital system. Again, though, Robin, one thing you have to consider when it comes to medicine here is that it's a private system. Hospitals are operated by different operators. It's a patchwork of different operators who are all sort of undertaking their own policies right now, and that is why there's such a resounding call for a coordinated federal response here.
Here in Canada, Jackson, the Prime Minister keeps getting asked, why are you not declaring a federal state of emergency? Why are you not invoking your federal powers? What's happening in the U.S. with the Trump administration?
There is a national state of emergency in place right now. The president has also said he's going to invoke a Wartime Production Act, which essentially lets the federal government order businesses to step up production of certain critical supplies. But it's sort of an open question right now, Robin, as to whether the White House has actually gone so far as to put in the ask with those companies to do that. We've seen companies like General Motors say, hey, we're willing to do this. We can retool and start making ventilators or start making masks. But the question is that a request officially coming from the White House yet, or has it come, or when will it come? There's a lot of sort of open questions around this right now. The White House has been more focused, specifically the president more focused, on urging the Food and Drug Administration to allow the use of some existing medicines, specifically some anti-malarial drugs, to be used to treat coronavirus patients. The president believes they could offer a glimmer of hope in treating this disease, but there's no proof of that yet. In fact, Dr. Anthony Fauci, who's the head infectious disease specialist here in the United States, sort of had to step up and contradict the president from the lectern yesterday and say, it's great if you want to go ahead and try this. It's great you've got hope that this will work, but we don't know. There is no proof that this will work. It's only anecdotal reports and small studies at this point. And he still wants proof that it's even safe to use this in coronavirus patients.
A big concern we have here in Canada are the Canadians that are stuck abroad. What is the U.S. president doing about the Americans who are stuck abroad?
It's almost an identical situation here in the U.S., Robin. A large tour group of Americans stuck in Peru, for example, many Americans stuck in Morocco. The U.S. has hinted that it may be a military effort to try and airlift those people out of those countries right now. A lot of it, though, is still in flux. And earlier this week, you saw the U.S. State Department issue a level 4 global travel advisory telling people, do not travel, do not leave the U.S., and return home while commercial means are still available, almost echoing the message we've heard from Prime Minister Trudeau in recent days. As we know, many of those air links have quite simply been severed, and so there really is a sort of confusing push underway to figure out the best way to get Americans back to this country right now.
All right, Jackson, thank you so much for your insight. The Canada-U.S. border would normally be bustling with weekend shoppers and tourists, but as of midnight Eastern, that all came to a halt. For the next 30 days, at least, only essential traffic will be allowed to cross. Our Jeff Semple is at the border in Niagara Falls.
Well, a Saturday during March break in Niagara Falls, Ontario, would normally be bustling with crowds and traffic, but take a look. You can almost hear a pin drop out here. It is an absolute ghost town, and this is part of the reason why. The border separating Canada and the United States now officially closed to all non-essential traffic. So tourists, cross-border shoppers, even asylum seekers are no longer allowed to cross this border in either direction as of 12:01 this morning. But it seems not everyone got that message. We were out here early this morning, saw a number of Canadians being turned back, including an older couple who were heading south to visit their son in the United States for the weekend, but told they were too late. They had to head home. We even spoke to one man, a Canadian, who was forced to walk back from the United States over a very chilly Rainbow Bridge in the middle of the night. It seems he'd gone out for the evening in the United States, perhaps had a couple of drinks. Then when his wife went to pick him up, she was told she wasn't allowed to cross and he had to walk home. But the government is stressing that essential travel will be allowed to continue. So those truckloads of food, fuel, and medicine that cross this border every day, that will continue. But for these communities along the border, including Niagara Falls, which relies on tourism, this move is devastating. Worse, they say, than it was even after September 11th. That was the last time this border closed in that way, and that closure only lasted a couple of days. This time, it's expected to last at least a month. Jeff Semple, Global News, Niagara Falls.
That is another example of the economic impact of the COVID-19 virus. Canada has more than 1,000 cases. BC is one of the major epicenters of the outbreak in Canada, with nearly 350 cases of COVID-19. Richard Zussman is in Victoria, BC. Richard, what's the public health official stance there?
Yeah, one of the big focuses here is a shift on how they're doing testing, Robin. That's one of the things that Dr. Bonnie Henry, the Chief Medical Health Officer, has been asked a lot about over the last few days. The reminder from Dr. Henry is that if you are not sick, you are not to get tested. So far, British Columbia has done close to 18,000 tests. There have been criticisms that that is not high enough and that people believe they should have access to those those tests. The province is trying to increase that testing capacity, but obviously, like we're seeing across the country, it's challenging. In terms of the number of deaths, there have been 9 in British Columbia. 8 of those are linked to the Lynn Valley Care Centre, and there are still people from the care centre who are hospitalized due to COVID-19. So that care centre continues to be a concern. Also, Robin, the province has put in, like a lot of provinces had, stricter measures around care homes. And so right now, there is very, very limited access to visiting care homes in order to try to prevent spread for the most vulnerable populations.
What kind of power has the public health officer been invoking during this crisis?
Very substantial powers, Robin. As you know, the province has both passed a provincial state of emergency and a provincial health emergency as well. And so that gives the province very significant powers. Yesterday, we saw Dr. Henry announce that all restaurants will be closed in British Columbia. They are only able to offer pickup and delivery services. That's just one example of an order that has been put in place. We've also seen municipalities put in place restrictions in some cases on businesses. There was a yoga studio in Delta where there were a lot of complaints from the community that that studio was advertising that they could help prevent the spread of COVID-19 through a hot yoga class. Dr. Henry said that was not true, and after those complaints, that yoga studio was shut down by the municipality. So there are a lot of tools here at the disposal. David was speaking a lot about the provincial powers. One power he didn't mention is the province here in British Columbia has the power to restrict the amount of food or products that British Columbians can buy. They have not used that power yet, but with hoarding that we're seeing in so many places, the province does have that power to create rationing.
Dr. Henry has been encouraging British Columbians to get outside, enjoy some fresh air, because we are essentially cooped up at home, working from home, and trying to follow the federal mandate that we should all stay at home. Any issues with that, though? Because you have seen people out having picnics and some group activities. She had some strong messages yesterday about that.
She did, and there have been some serious issues with it, Robin. The rules here are this. You must social distance. You must be 6 feet away from those people who are not in your very closest bubble. And if you cannot prevent that, you should not be outside. There are also those restrictions on gatherings of more than 50 people. But Dr. Henry is concerned about what we've seen, gatherings on some of Vancouver's beaches or in some of the parks. Yes, people are being encouraged to go outside, try to enjoy some of the fresh air, but do not gather closely with people who are not in your tightest bubble. And if this continues, it seems, Robin, that the provincial government here would be willing to step to the next step, which could very well restrict people from going out into public spaces.
I know that we were limited with our supplies for testing, and yesterday the Prime Minister announced that he is working with industry to get more swabs out. What was the response from the provincial government?
Appreciated by the provincial government, Robin. The BC government is also trying to increase testing capacity. They are also being creative in terms of mobile testing areas. There are a lot of steps being taken to ensure that those tests are being done for those that need them. That's the key point from Dr. Henry. There's also a push as well to ensure that BC has the equipment needed. It's like that for every province across the country, Robin, that every province is looking to get those respirators as well as the medical equipment needed. A focus yesterday as well from Dr. Henry was just a thanks to those frontline health workers who have been dealing with this. We've also seen some substantial support from the province for childcares. That's been a substantial issue in many places. For those essential workers that need somewhere for their kids to go, the province has stepped up to ensure those child cares can continue to stay open when they're seeing a lot of the people who are normally in those child cares drop off because they're staying at home with their parents.
All right, Richard, thank you so much for your time. As we mentioned earlier, we have more than 1,000 cases here in Canada. The Prime Minister is reinforcing that we all must stay home, work from home as much as possible. Here's what he announced just moments ago, that the federal government is working with airlines to help bring Canadians home from abroad, but the Prime Minister does admit that it may not be possible for everyone to get home, reinforcing what his Foreign Affairs Minister has been saying all along. Trudeau also discussed the possibility of limiting movement inside Canada as parts of northern Canada aim to prevent the spread of COVID-19. The fortunate news is that we do not have any reported cases in the territories. And of course, the Prime Minister is also reminding Canadians to stay home during this pandemic. He is basically telling you to be prepared for weeks, possibly months, and that this is not going away. In fact, we're probably likely going to see more cases, more deaths. This is something that has never been seen in this country, in this world, as you can see from examples and what happened in China, what is happening now in Italy. We are trying to prevent that, and this is the reason why this mandate has been put into place, that we all must stay home and not go out and not socialize. And unfortunately, there are people who are breaking those rules, but the enforcement measures are coming into place. And you can find more details at globalnews.ca and on Global National tonight. I'm Robin Gill. Thank you for watching.
This has been a special report from Global News.
Travaillent sans relâche d'une océan à l'autre pour trouver des cas, retracer les contacts et interrompre la transmission en vue de ralentir la propagation de la COVID-19. En mon nom, celui de la Dr. Tam et celui de tous les Canadiens, je tiens à les remercier de leur dévouement. Dans la même veine, nous remercions les nombreux Canadiens qui apportent leur contribution en changeant leur comportement, leur routine et leur projet pour relever ce défi national et aplatir la courbe. J'encourage tout le monde à poursuivre ces diligents efforts de distanciation sociale en cette période critique. Cela signifie qu'il faut maintenir une distance de 2 mètres lorsque vous faites la file à l'épicerie, lorsque vous saluez un ami lors d'une promenade à l'extérieur ou lorsque vous discutez avec des collègues de travail si vous devez vous rendre au bureau ou sur un chantier. Our public health colleagues, healthcare and laboratory professionals have been working day and night across the country to find cases, trace contacts, and interrupt transmission to slow the spread of COVID-19. On behalf of myself, Dr. Tam, and Canadians across the country, I want to thank them for their dedication. Likewise, our thanks go out to the many Canadians who are doing their part by changing behaviors and routines and disrupting plans to take on this national challenge to flatten the curve. I encourage everyone to continue with all due diligence to maintain social distancing at this critical time. This means maintaining a 2-meter distance when standing in line at the grocery store, when saying hi to a friend while out for a walk, or when engaging with work colleagues should you be required at the office or job site. The time has been challenging, and it's not over yet. It is still too soon to say how much we have affected the trajectory for Canada, but as Canadians, we are all united in knowing that the best play is to look ahead, not give up, and go where the puck will be going. There's no doubt our efforts are having an impact, and not making these efforts is simply not an option. Let's keep up the momentum. Let's get this right. Merci.
Thank you. Thank you very much, Dr. New. And now we'll turn to Minister Champagne for some words.
Merci, Madame la Ministre. Bonjour à tous et à toutes qui nous regardez aujourd'hui. Merci d'être avec nous aujourd'hui dans des circonstances, disons-le, extraordinaires. Mon message s'adresse aux Canadiens, aux Canadiennes en attente de revenir au pays en raison de la situation mondiale concernant le COVID-19. Je comprends votre souhait de revenir le plus rapidement possible à la maison. Je comprends également votre anxiété face à la fermeture des espaces aériens, des frontières à travers le monde et l'annulation de nombreux vols par les compagnies aériennes vous empêchant de revenir à la maison. Sachez que nous travaillons sans relâche pour dénouer ces situations excessivement complexes et je dirais même sans précédent. Notre priorité, ma priorité est d'assurer le retour en toute sécurité des voyageurs canadiens qui se trouvent présentement pris à l'étranger. Depuis maintenant plusieurs jours, j'ai été en contact continu avec les dirigeants des compagnies aériennes canadiennes et internationales pour trouver des solutions face à l'énorme défi logistique auxquels nous faisons tous face. La situation, mesdames et messieurs, change d'heure en heure. Les pays imposent des restrictions sur les vols. Les aéroports augmentent leur contrôle de sécurité. On les comprend parce que nous avons fait de même ici au Canada. Parce qu'on veut tous et toutes limiter la propagation du virus, parce qu'on veut tous et toutes protéger nos populations. Au cours des derniers jours, j'ai également été en contact avec mes homologues de plus d'une quinzaine de pays pour coordonner nos efforts, y compris avec plusieurs de nos partenaires du G20, avec lesquels j'ai eu un troisième appel à 7 heures ce matin. J'ai notamment été en contact avec mon homologue marocain afin d'organiser le retour de Canadiens qui sont à bord du vol d'Air Canada qui, ce soir, partira de Casablanca en direction de Montréal. Dans les prochains jours, d'autres vols permettront à des Canadiens de revenir du Pérou, de l'Espagne et d'ailleurs en fonction des besoins, de la capacité des transporteurs aériens et des arrangements que nous serons en mesure de négocier avec les pays concernés. Car la complexité est grande. Certains ont fermé leur espace aérien, certains ont fermé leurs frontières, certains même ont fermé leurs aéroports. Mais nous travaillons sans relâche pour assurer que les Canadiens puissent revenir à la maison. Nous faisons évidemment tout ce qui est en notre pouvoir pour ramener à la maison, comme le premier ministre le disait plus tôt, le plus grand nombre de Canadiens, évidemment, le plus rapidement possible. Ceci dit, je tiens à le répéter. Il ne sera malheureusement pas possible pour nous d'assurer le retour de tous les Canadiens et Canadiennes qui souhaitent revenir de l'étranger. Je rappelle que nous avons mis sur pied un programme d'urgence pour soutenir les Canadiens coincés à l'étranger suite à la pandémie par un prêt pouvant aller jusqu'à 5 000 $. Que ce soit pour un vol de retour ou pour des frais de subsistance, on veut vous aider dans ces moments les plus difficiles. Nous avons aussi demandé aux compagnies de télécommunications de nous aider à envoyer des messages textes aux voyageurs canadiens pour leur permettre d'accéder à cette aide le plus rapidement possible. En quelques jours, nous avons rejoint des centaines de milliers de Canadiens. Encore une fois, aux Canadiens à l'étranger, je veux que vous sachiez que nous sommes à pied d'œuvre 24 heures sur 24 pour vous aider. En terminant, j'aimerais dire un mot à nos chers snowbirds qui nous regardent. Je tiens à leur rappeler qu'ils devraient rentrer au pays dès que possible, surtout que les vols se font de plus en plus rares. Je tiens par ailleurs à les rassurer, tous et toutes, que la frontière sera toujours ouverte, évidemment, pour le retour au Canada. So, let me say thank you, everyone, for watching us today. We must admit we're living some extraordinary times. I'm here today to speak to Canadians who are waiting to come back to Canada due to the global COVID-19 situation. I understand your desire to get home as quickly and as safely as possible. I understand your anxiety as you see countries around the world close their airspace or their borders and more airlines canceling their flights, preventing you from coming home. Please know that we are working around the clock to resolve this extremely complex and unprecedented situation. Our priority, my priority, is to ensure the safe return of Canadian travelers back home. For several days now, I've been in constant contact with representatives from Canadian and international airlines to find solutions to this enormous logistical challenge. The situation is changing, ladies and gentlemen, hour by hour. Countries impose new flight restrictions. Security control are enhanced at airports. We understand why other countries do this, because we have done so as well to limit the spread of the virus, to protect you and every other Canadians. Over the last few days, I've also been in touch with counterparts from more than 15 countries to coordinate our efforts. I also had a third call with some of my G20 partners as early as 7 o'clock this morning. Notably, I've been in touch with my Moroccan counterpart to organize the return of Canadians who will be on a flight from Casablanca to Montreal this evening. In the next days, other flights will get Canadians out of Peru, Spain, and elsewhere, according to the needs we identify, the capacity of our airlines, and the arrangements we are able to negotiate with the countries concerned. We are doing everything in our power to bring the largest number of Canadians home as quickly as possible. I must, however, repeat something I've said before. Unfortunately, it will not be possible to ensure the return of all Canadians who wish to come home. I would like to remind Canadians that we have set up an emergency loan program which provides up to $5,000 to help those Canadians stuck abroad due to this pandemic. Whether it's to help with the cost of a last-minute flight home or the unexpected costs of extended time out of the country, we want to help you in these very difficult times. We have also asked telecommunications companies to help us send text messages to Canadian travelers to help them access this help quickly. In a few days, we have reached hundreds of thousands of Canadians. Once again, to Canadians abroad, I want you to know that we are working around the clock to help you. In closing, I would like to say a word to our beloved snowbirds. I want to remind them that they should return to Canada as soon as possible, especially as flights become increasingly scarce. And I want to reassure them that the border will always be open for them to return back home in Canada. Thank you very much.
Thank you very much, Minister Champagne. And now we will turn to Minister Garneau.
Thank you very much. And in the interest of brevity, I won't repeat things that have already been said. But as you all know, the COVID-19 pandemic has created an unprecedented crisis in the global aviation industry that is already having a significant impact on the air transport industry, on travelers, on shippers, and on the economy. We're working to keep the air sector flying in order to get Canadians home, as Minister Champagne stated, and also to ensure that air cargo chains are not disrupted. But right now, there is an immediate need to help to get Canadians who are stranded abroad due to a lack of available flights back to Canada. Upon their return, as is the case with all people entering or re-entering Canada, we are asking travelers to self-isolate for 14 days. Je dois également mentionner que tous les autres procédures doivent être suivies également, y compris s'assurer que les passagers ne présentent pas de symptômes de la COVID-19 avant d'embarquer. Les voyageurs présentant des symptômes ne pourront pas prendre l'avion. In closing, I would like to take a moment to recognize and thank workers across the transportation sector. In the face of challenges, they are continuing to keep our people and goods moving. Pilots, air crews, air traffic controllers, port workers, mariners, train crews, truck drivers, and so many others are so very critical to getting supplies to people and sustaining the Canadian economy. À mesure que la situation évolue, je sais que nous pouvons compter sur nos partenaires du secteur des transports qui travaillent avec nous au bénéfice des Canadiens et des Canadiennes afin d'assurer la mobilité des personnes et la circulation des marchandises dans les circonstances très difficiles. Merci.
Thank you. Thank you, Minister Garneau and Minister Bibeau.
Thank you. Bonjour à tous. Alors hier, nous avons confirmé que les travailleurs étrangers temporaires seront autorisés à entrer au Canada malgré les restrictions de voyage dues à la pandémie de la COVID-19. C'est une excellente nouvelle pour les productrices et producteurs agricoles qui comptent sur eux pour cultiver leurs champs et pour les entrepreneurs qui ont désespérément besoin d'eux dans les usines de transformation alimentaire. Il s'agissait ni plus ni moins que d'un impératif de sécurité alimentaire.
Over the past several days, we have heard urgent concerns about access to seasonal labor for the coming planting season. Our government is pleased to reassure farmers and food businesses that foreign workers will be allowed to enter Canada, provided they observe a 14-day period of supervised isolation. Temporary foreign workers are absolutely necessary for our farms and our agribusinesses, filling over 60,000 jobs across the country. Our very food security depends on them. La prochaine étape consiste à obtenir de la part des pays d'origine de ces travailleurs des permissions de vol pour que les avions qui seront nolisés par l'industrie et payés par les employeurs puissent avoir lieu. Our government will work with the relevant countries to obtain authorization for the flights chartered by the industry, paid by the employers. Dans l'intervalle, en collaboration avec les représentants du secteur et nos collègues des provinces, nous finalisons un protocole d'isolement supervisé. Chaque employeur aura la responsabilité de mettre en œuvre ce protocole d'isolement de 14 jours de façon stricte, sous peine de perdre son privilège de pouvoir engager les travailleurs étrangers pour les années à venir. Et croyez-moi, c'est pas ce qu'ils veulent. Dans le contexte de la pandémie de la COVID-19, je tiens à rassurer tout le monde que nous prenons toutes les mesures qui s'imposent pour protéger votre santé, tout en nous assurant aussi que vous ayez des fruits et des légumes frais, des produits transformés locaux de grande qualité sur les tablettes de vos épiceries. Et je veux aussi vous rassurer qu'il y aura toujours des emplois disponibles pour les Canadiens dans les fermes et dans les usines de transformation alimentaire. I can assure you that there will always be jobs available for Canadians who wish to work on farms and food processing plants. On a un système alimentaire fort et résilient au Canada. On va passer au travers de cette crise sans manquer de nourriture. En ces temps difficiles, c'est important de remercier les travailleurs des secteurs agricoles et alimentaires, les productrices et les producteurs agricoles, les gens qui travaillent dans les usines de transformation, les épiciers, les employés, les camionneurs, les bénévoles dans les banques alimentaires et dans les popotes roulantes. Et tous ceux qui, malgré leur inquiétude, se présentent au travail tous les matins afin que nous ayons de quoi manger. Dites-leur merci la prochaine fois que vous les verrez. Prenez le temps d'apprécier à quel point leur travail est essentiel pour vous. It is important we thank all the farmers, processors, truckers, employees, employers across the agri-food value chain, including volunteers in food banks and those who deliver Meals on Wheels. We owe them a high quality food we have on our shelves and our tables. Now, more than ever, everyone can appreciate just how essential they are to our society. Thank you.
Well, thank you very much, everyone. And I'll just have a few closing words, and we'll turn to questions. First of all, I just want to remind Canadians this is the time to remember to be kind. Now is the time to help. Now is the time to donate to a food bank. Now is the time to volunteer safely. Now is the time to donate blood. Don't stockpile food or medicine. Leave some for those that need it. These are practical ways that you can help your community right now. It is a historic time, and it's a time where people feel more alone than ever. Your government is working very, very hard to try and keep your family and loved ones healthy and safe, protect you financially, and work to find the solutions to bring a close to this time. But it is not easy, and it may get harder. And we will need all Canadians to win this war with a very fast-moving and invisible enemy. So I want to thank everyone out there. I know that people are making historic sacrifices in ways that we know and in ways that we don't know. And now we'll turn to questions from reporters. Thank you.
Okay, so we'll take 3 questions from the room and go to the phone. 1 question, 1 follow-up. Commençons en français. Michel Lamarche, TVA.
We'll start with TV.
Vous avez donc annoncé que les vols de rapatriement commenceront. On peut parler d'une première vague. Il y a bien des gens qui sont coincés en Équateur, qui nous parlent d'une situation là-bas extrêmement précaire. Pouvez-vous nous dire si vous avez eu des discussions avec vos homologues en Équateur, si les gens en Amérique du Sud ou en Amérique centrale, vous allez pouvoir les rapatrier?
Alors, d'abord, merci de votre question. Oui, je suis très saisi de la situation présentement qui évolue en Équateur. J'ai un appel prévu avec mon homologue de l'Équateur plus tard cet après-midi. On suit cette situation-là de près. Vous savez, ce que je disais dans mes remarques plus tôt, on fait face à des circonstances sans précédent. Des espaces aériens qui ferment, des frontières qui ferment. Dans certains pays même d'Amérique du Sud, on a vu la loi martiale imposée avec du couvre-feu. Alors, ce qu'on est en train de faire pour aider les Canadiens et les Canadiennes à revenir, c'est d'abord d'avoir des appareils. Moi, je dirais que c'est l'étape 1. C'est souvent l'étape la plus simple. Ensuite de ça, c'est de négocier et de s'assurer, évidemment, que les gens puissent arriver jusqu'à l'aéroport. Donc, on doit négocier pays par pays un droit de passage pour les citoyens canadiens qui veulent revenir chez nous. Comme on a fait au Pérou, je serai en contact avec mon homologue d'Équateur et j'ai bon espoir qu'on arrive là aussi à trouver une solution pour permettre aux Canadiens de rentrer à la maison.
So what I was saying is that I'm very much seized of the evolving situation in Ecuador. As I said in my remarks, we are facing something which is quite unprecedented, where airspace is being closed, airports are closed, travel restrictions are imposed. Even in some countries in Latin America, we've seen martial law being imposed with curfew. So we are working to solve this situation, making sure that we can ensure that Canadians can get to the airport. Like I say, the plane is usually the easiest step in all that. After that is to negotiate country by country the type of restriction they have imposed and make sure that they would give safe passage to Canada. One of the things I did in a call this morning with a number of G20 countries, the hotspots are pretty similar for a number of like-minded nations around the world. So we have invited, for example, this morning, our colleague from Morocco and Peru to give an update about the situation. We're trying to help each other because this is a very fluid situation. The circumstances on the ground evolve hour by hour, and we are very much seized of the issue in Ecuador to bring Canadians back home.
Comment vous pouvez faire pour rassurer les Canadiens? Est-ce que vous pouvez d'abord leur donner une idée de l'espace-temps dans lequel vous allez pouvoir travailler? Est-ce que c'est une question de semaines? Est-ce que c'est une question de mois? Et est-ce que vous pourriez nous dire avec quel pays vous êtes en discussion pour que les gens sachent que ça évolue pour eux sur le terrain?
Merci pour votre question et je pense que dans des circonstances sans précédent comme celle-là, c'est important de communiquer, comme vous avez dit, Mme Lamarche, pour rassurer les gens. J'essaie de le faire constamment. Dès que j'ai un appel, j'informe les Canadiens. On a eu un appel aussi avec l'Inde ce matin pour essayer de résoudre un enjeu qui est en train de se développer. On est en contact. Évidemment, les endroits qui deviennent plus problématiques à l'instant, on a certainement le Maroc, le Pérou, l'Espagne, l'Équateur, dans d'autres mesures, les Philippines, où on avait vu des enjeux se développer. Et ce que je m'engage à faire, c'est de mettre à jour les Canadiens et les Canadiennes aussi régulièrement que possible. Vous comprendrez, souvent, il faut faire décision, action, information. Il faut d'abord que je passe le temps à résoudre les enjeux pour permettre évidemment aux appareils, le cas échéant, de pouvoir rentrer dans l'espace aérien, de rapatrier les gens. C'est ce qu'on va faire, mais le meilleur conseil que je pourrais donner aux Canadiens, aux Canadiennes qui nous regardent, ici comme à l'étranger, c'est inscrivez-vous sur le site du gouvernement du Canada pour avoir toute l'information possible. Suivez les plateformes de médias sociaux parce qu'on met l'information au moment même où on la reçoit avec des solutions. Nos ambassadeurs, ambassadrices à travers le monde constamment mettent de l'information pour les Canadiens, par exemple, parce que ce qu'on a négocié avec certains pays, c'est que les Canadiens, pour embarquer, par exemple, sur un vol, on a eu ça du côté du Maroc avec Turkish Airlines qui nous a offert à travers le ministre des Affaires étrangères de la Turquie que les Canadiens puissent arriver sur ce vol-là, ensuite transiter vers Londres ou Paris, vers le Canada. On va s'assurer de maintenir des ponts aériens entre, évidemment, l'Amérique du Nord et l'Europe, l'Asie et l'Amérique latine pour permettre au plus grand nombre de gens de revenir à la maison. On parle de jours dans les cas les plus urgents, évidemment, mais je veux dire aux gens qui nous regardent, ça dépend toujours des circonstances, des conditions, des règles qu'on nous impose sur le terrain. Et notre travail présentement, jour et nuit, c'est d'essayer de régler ces situations-là pour permettre aux gens de rentrer à la maison.
Ashley Burke, CBC.
How many Canadians do you have that have checked in abroad that want you to help them get back? And as well, in Peru, they've said as of tomorrow that they will no longer allow anyone to be repatriated from outside of the country. There's a real sense of urgency there. I mean, the Prime Minister said this was potentially a flight going there. Can you assure families that have loved ones there that this is going to happen in that time frame? And as well, people stranded on cruise ships that can't dock, what are you going to be doing for them?
So let me take the situation of Peru and be very, very, very clear with Canadians, because I think in times like that, information is key. So this morning at 7 a.m., we had a call with a number of foreign ministers of the G20. I invited the Peruvian and Moroccan foreign minister to give an update to make sure that we understood the conditions on the ground, because Peru and Morocco have evolved into hotspots for a number of countries in the last few days. We got reassurance at 7 a.m., let's say perhaps 7:30. I can't remember exactly when he spoke on the call, but early in this morning, we got reassurance that flights that would bring
Canadians back home would be allowed to leave the airspace and obviously to land and take passengers and leave. I am well aware that the Minister of Defense of Peru did issue a notice after that. I did speak following that, calling back my counterpart, which we're going to have a further call this afternoon to make sure that this is still the case. And I called the permanent representative in New York to ensure that Canadians would have safe passage. With respect to your other questions, with respect to cruise ship, we're monitoring situation in a number of places around the world, as you would expect. Yesterday, we were successful in bringing Canadians from Marseille through cooperation with our U.S. colleagues, and we will continue. But obviously, all that we do needs to be subject to all the health and safety and all the recommendations that Minister Aidu have been put in place, making sure, as Minister Garneau said, that anyone who's boarding would have to be asymptomatic. They would have to self-isolate for 14 days, and we will follow every protocol that's put in place by the Public Health Agency of Canada. With respect to the number of Canadians, listen, this is not an exact science, but what I can tell you is that there's probably tens of thousands of Canadians abroad. Some want to come back, some would rather stay there. So what we're making sure is first, as the Prime Minister said this morning, and with Minister Garneau and everyone, is to try to facilitate as many flights back to Canada so that people can come back home. And for those that may not be able to come back, that we will continue to provide consular assistance as we've done with respect to the first cases that came in Japan and those that we had in the coast of Oakland. We will continue to support Canadians the best way we can.
There's been a real call on Canadians to work together through this, and many of you have said that that's really going to be the key to success. Today, for the first time, we saw that they're not going to be allowing, to travel in provincial borders into the Northwest Territories, and other premiers have raised this as a possibility. Do you foresee more of that, and what happens to the sense of solidarity when you see requests like that?
So that's a very live issue right now that we're talking about, both at the Public Health Officer of Canada level in the Special Advisory Committee that Dr. Tam chairs with other public health officers across the country, but also in many other tables. I mean, there are reasons why provinces may want to do that, and they're fair reasons. I mean, if you have a province, for example, with no cases, you may think that you might be able to contain that province and limit the spread. We do believe that there's some value in regional containment, but we also want to make sure we do it in a way that doesn't disrupt our domestic supply chains, that domestic needs to get goods and services from one part of the country to another. I know that the Prime Minister is having conversations with premiers. I am having conversations with ministers of health. I think whatever we do as a country, it has to be based on the best science available, understanding that obviously things are evolving. And with the focus to contain hotspots in our country of COVID-19 infection.
CTV.
Ian Wood, CTV News. Evidence from COVID-19 hotspots like Italy has indicated that even a full lockdown is not enough to keep its citizens inside. How does Canada expect to plank the curve, as Dr. Tam said, with even less strict measures? And isn't it time we go further to truly plank that curve?
I'll answer and then I'll turn to Dr. New because I think he'll be able to speak from the science perspective. I mean, I think it's very difficult to compare country to country in a very sort of rudimentary way like that. Italy took a number of measures early on that created a crisis for them that we, quite frankly, didn't see. Not to say that we're not concerned about the increase in cases. As Dr. Tam mentioned yesterday, though, the cases that we see right now are actually a reflection of what was happening 2 weeks ago. So I think we'll have a better sense of whether the measures we've put into place are working in the next, I'd say, 7 to 10 days. Those conversations are happening around more stringent measures, but I would say that they have to be applied in ways that make sense to continue the functioning of society. And when I say that, what I mean is obviously we have hotspots in Canada that we need to keep our eye on, and I know that provinces are working very hard to figure out how to do that, and we're there with them to talk about measures that they can take. But it does not make sense from my perspective as a health minister to put an entire country on lockdown if, in fact, we don't have the need to do so from a science perspective. In fact, it could create even more harm People still need to eat. We still need things to get across the country from place to place. You've heard about the challenges that our farms and our food producers are having with labor. These are real challenges as well. And obviously the steps that we take have to be measured to balance all of those perspectives while also doing the absolutely best we can to contain the virus in the locations that it's at. So those conversations are happening right now. Will there be additional measures? There very well might be. But at this point, those conversations are ongoing, and it's too early to hypothesize what those might be. I'll turn to Dr. New for some of the science behind that.
Sure. Thank you very much, Ms. Minister. Exactly as the Minister said, at the technical level, the Special Advisory Committee, on which both Dr. Tam and I sit, along with the Chief Medical Officers of Health of all the provinces and territories, we're having very live conversations. And one of the things is that we're always looking at the science and the public health principles. So the idea of social distancing, we're obviously pushing that out, saying that it's important for every Canadian to have a role to play. But we're also looking at very important vulnerable settings. So things such as long-term care facilities, that's a hotspot. We're all aware of the outbreak that occurred in Vancouver. So those types of vulnerable settings we need to pay special attention to. And it's interesting, even the last question, you can see how that principle applies to the Northwest Territory, because that, in a way, you could consider a vulnerable setting because of their infrastructure, their limited access to healthcare services. It's the same principle. Should a case occur there, it would be much more challenging to deal with. In the same vein, it would be challenging to deal with a case in a long-term care facility. So the principles apply. We're working very closely in terms of what kind of measures need to be taken across the country, depending on context. So certainly in provinces like Ontario and British Columbia, where they are in sort of the pandemic, with hotspots, community clusters, that's where the focus needs to be. In other provinces that have relatively few cases, I'm aware in the Atlantic provinces, most of their cases, if not all, are related to travel, and therefore their focus might be looking at symptomatic travelers coming back to those jurisdictions. But as Minister Hajdu has said, we're obviously looking at it day by day. Our Special Advisory Committee has met several times. We're having another meeting again tomorrow on a weekend and then during the week. And we're continuing to look at and obviously change and modify our public health actions as appropriate.
And I just wanted to follow up on a question of ventilators. We've not had a number so far on nationally how many ventilators are available. And there's been a patchwork of numbers from provinces on how many provinces have. So to give Canadians a sense of preparedness in terms of our stockpiles, how many ventilators does this country have ready to go?
I could answer with a quick answer, but I'm going to unpack that a bit. So certainly at the planning we're doing at the technical level, we have to understand the epidemiology, what's happened in other countries and also experience here in Canada. So certainly from the science we have to date, most people that get COVID-19 actually have a relatively mild illness. It can be actually treated at home and never need to go to a hospital, and that's about 80%. And then you get obviously a smaller percentages that need medical care, might need hospitalization, and in the worst case, may need to be in an ICU and have assisted breathing through a ventilator. So all those calculations are there. One of the other things we look at in terms of our projections is what we call the attack rate. And that's something that's why it's so critical now in terms of our social distancing. The attack rate can be changed by what we do now. If we do nothing at all, no control measures, no social distancing, the attack rate will be much higher than if we actually implement measures such as that. So based on the attack rate, based on whether we do social distancing measures or not, we are also modeling. So in terms of the estimates, Canadian population, we estimate that the need for ventilators could be anywhere from 1,000 to 3,000 to 5,000, whatever it might be, depending on the scenario. But that's the other part that's important, because if you look at the healthcare system planning, it's not just about the total number of ventilators, it's when you would have to actually use them. The thing is, that's why flattening the curve is so important, because if you actually, let's say for an example, 1,000 people need a ventilator if they have a serious case of COVID-19. There's a difference if all those 1,000 people occur in a matter of a few days compared to spread out over several weeks and months. So that's part of the thinking that we want to do across Canada. Stretch it out, spread out the actual severe cases that the healthcare system could deal with. So that's on the planning side in terms of how many ventilators we may need. The other part also is that they're a machine. So even if you had how many ventilators, it's not just about having them in their boxes. They actually need to be in rooms, in hospitals. So there's a lot of planning that needs to go in terms of how many rooms can be freed up. That's why many provinces are looking at freeing up beds by, canceling non-elective surgeries. So lots of sort of things that are in the mix rather than just, quote, focusing on the number of ventilators. Then, of course, when you actually have the ventilators, you need to have trained staff, people know how to use them, and, of course, how you distribute them depending on the situation. At the federal level, we're working closely with our counterparts. We've done estimates. The federal government is buying, I think, right now about 500 ventilators to actually support, should there be a need to maybe distribute the ventilators depending on a hotspot somewhere in the country. There's also, as Dr. Tam mentioned yesterday, a mutual assistance agreement in place. Should there be a need for one province to request ventilators or even personnel or other resources from one province to another. So that's all in the planning phase. But the short answer then is that with all that in the mix, the number of ventilators at the current time, we're still doing the inventory, is about 5,000 across the country.
Okay, we'll turn to the phone.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour toute question. There will be a brief pause while the participants register for questions. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Thank you for your patience. Merci de patienter. Our first question, notre première question, is from Lina Dib. La première question est de Lina Dib de la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour. I'm going to ask my question in English, but if I can get a French answer as well, it's fine as long as there's information in it. Maybe it's for you, Minister Hajdu. Why wouldn't Quebec closing its border be useful when they look at its border with Ontario, when they see more than the double of cases in Ontario than they have, because the two provinces did not take the same measures? Et peut-être, Dr. Nou, si vous avez un chiffre différent que celui du début de la semaine, me le donner sur le nombre de transmissions communautaires. Vous aviez dit 17% depuis 2 semaines. Si vous n'avez pas de nouveaux chiffres, vous pouvez laisser faire.
And if you don't have any new numbers, then you can.
You know what I'm going to do? I'm going to answer in English, and then I'm going to turn to one of my admirable French ministers to give the response in French, and that way we can provide you both official languages. Listen, those decisions, as I said earlier to another questioner, have to be based on science and evidence, because the challenge with just locking down a province or locking down a part of the country without using the epidemiology to make those decisions could mean other kinds of suffering for those particular residents of that province or region. We need to keep the flow of goods and services happening in our country as well. We need to make sure that people can work, that they can work from region to region. I think there is nothing wrong with asking Canadians who can do so to stay put right now, and I think Dr. Tam has said that. Please stay home. If you do not have a need to travel in this country or out of this country, obviously, please stay home, and I think that is important no matter where you live. But let's be realistic. Also, we need essential services to be traveling across this country. We need to be able to move food and other essential goods across this country. So we have to do this together. We have to do it in a way that's coordinated, and we have to be using the epidemiology in a way that's going to guide our decisions. And I will just point to China as an example, an early example. You know, China took some of the most extraordinary measures at the beginning of this outbreak, as you can recall, but they didn't close down their country. What they did was really target in where they saw their hotspots so that they could keep the rest of the country functioning. It's, you know, none of this is perfect. Obviously, this is you know, based on human behavior, and we do live in a democracy. But we know that Canadians are up for this challenge, and we know that they will respect these pleas that we're giving to them. That they need to take this seriously for the health and safety of their family and their loved ones, and for their fellow Canadians. So I will turn to Minister Garneau, who would like to take the first translation. Thank you.
Merci. Dans le même sens que c'est essentiel pour nous de maintenir le transport du commerce entre le Canada et les États-Unis, la même logique s'applique pour tout le Canada. Nous sommes le deuxième plus gros pays au monde, avec énormément d'espace pour le transport. Et c'est absolument essentiel que nos corridors de transport et de commerce restent ouverts pour transporter à travers le Canada, non seulement par camion, par train et par d'autres modes, par avion, les biens essentiels dont notre pays a besoin. Alors, pour ces raisons-là, c'est important de garder une certaine ouverture dans nos frontières provinciales et de continuer à faire ce transport pour le bien-être des Canadiens et pour l'économie.
Merci, Minister.
Thank you, Minister.
Peut-être c'est Dr. New, je peux ajouter quelque chose en
Dr.
français.
New, I'd like to add something in French.
Je ne veux pas répéter, souligner que les ministres ont déjà dit, mais je pense que c'est important. On parle de l'échelle technique de santé publique. On a toujours le comité consultatif spécial avec Dr. Tam et moi. On travaille étroitement avec nos homologues. C'est aussi Dr. Ruda qui est très connu maintenant au Québec. Et on discute toujours les enjeux pour avoir une cohérence. Si on parlait des principes et une approche de santé publique, c'est important d'avoir une cohérence parce que les principes de la distanciation sociale, ça s'applique au Québec et même en Ontario. Et pour des raisons même personnelles, ça ne fait pas de sens parce que mes deux fils habitent actuellement à Montréal.
My two sons currently live
C'est tout.
in Montreal.
Maintenant.
But that's all I'll say about that for now.
Donc, si je peux relancer, donc je comprends, Dr. New, vous n'avez pas une nouvelle statistique pour le nombre de transmissions communautaires. Et ma question, c'est, on l'a fait avec les États-Unis. Alors, pourquoi pas ne limiter les déplacements au Canada que pour les déplacements essentiels, donc les marchandises, le commerce, les travailleurs, et boucler tout le reste, comme on l'a fait avec les Américains, comme on le fait avec le reste de la planète, entre les provinces.
Bon, je pense que peut-être souligner les points que les ministres ont déjà fait. C'est important aussi de continuer, comme dit la chaîne logistique, la transportation des biens et des services essentiels à travers le pays. C'est important parce qu'on est un pays. Moi, je pense que aussi, si on parle d'une cohérence, je pense qu'en fin de compte, on est tous des Canadiens. Ce n'est pas des Ontariens ou des Québécois, on est tous des Canadiens. On en parle aussi d'un effort. Je pense qu'hier, quelqu'un dit que c'est comme un effort, warlike effort, un effort de guerre. Je pense que c'est aussi une mentalité, une attitude que je pense que ce n'est pas seulement le secteur privé ou le gouvernement, c'est tous les Canadiens et Canadiennes. Si on a les mêmes objectifs, on tient tout le monde dans la même direction. C'est même peut-être les générations plus vieux qui savent déjà qu'est-ce qu'ils demandent comme sacrifice pour un défi comme ça. Maintenant, l'ennemi, c'est un virus. Je pense que ça, c'est la mentalité, l'attitude qu'il faut avoir à travers le pays. Okay, I'm trying to think. Certainly, even in this country, it's important to maintain, how you say, the supply chains, essential goods and services in terms of across the country, because certainly goods and services in one part of the country are needed, maybe manufactured in one province, are needed in another. I think, to sum up, I think at the end of the day, we're all Canadians. You know, we're not Ontarians or Quebecers. We're all on the same team, Team Canada. And I think the reference was made yesterday in terms of a war effort. And I think it was put in the context of industry in terms of wrapping up or retooling in terms of the kinds of products that Canada needs. I would say that same mentality applies to all Canadians. I think the older generations may know better in terms of what it takes in terms of the sacrifice and what all Canadians need to do in terms of a wartime effort. So I think I would exhort all Canadians, think of it that way. We're all in the same fight, in the same war against the virus, and everyone has a role to play.
Okay, next question on the phone. Just a friendly reminder, one question, one follow-up. Thank you.
Next question. La prochaine question is from Alex Bellingham from Toronto Star. La prochaine question est de Alex Bellingham du Toronto Star.
Hi, just on the race for a vaccine, what is Canada doing to accelerate the push to get a vaccine for this? And when do you think that will happen?
I'll give some general comments. I don't know if Dr. New has more detailed comments, but I will say that early on, we've been investing early on. Feels like every day is a week, doesn't it? But very early on, we knew that we had to get our researchers and our scientists in the game of vaccine development and have the money and the tools and the capacity to be present in that space of working on vaccines, but more than vaccines, on treatments as well. And so it seems like a lifetime ago, but 2 or 3 weeks weeks ago, I was with many of my colleagues in Montreal making an announcement of the initial down payment on that investment. And since then, we've put another $300 million towards the great projects that were already, that had been applied for. We were astounded by the number of projects that came in. And I want to thank all the researchers and scientists that both applied for money, but then also volunteered countless hours to peer review all of those applications to make sure they were quality applications. And what we found was that there were more applications than we had money for. So we immediately found more money to fund all of those scientists and researchers to do that work. That work is not happening in isolation. Canada is also working on an international stage on this and contributing our science and our research to the international work that's happening. Everybody's searching for the cure, and everybody's searching for it in two ways. One, through a vaccine, and two, through any kinds of medical treatments that could lessen the severity of the symptoms for those people most seriously affected. The other piece of research that's really important is people are looking at how we actually get out of this if we are not able to find a vaccine in short order. And so there is a lot of research happening around social distancing methods and how we move forward in the next stage to manage any second wave of this particular virus. This is a long-term project. There are some promising things happening. There are some vaccine trials happening already now, limited nonetheless, but still promising. There are 2 or 3 medications that are being tested as we speak. But of course, we've accelerated our processes here in Canada, by the way, various regulatory processes to make sure that we can get access very quickly, that we can ensure that we can facilitate those clinical trials as quickly as possible. But let me be clear: the vaccine and treatment piece may be still quite far in the distance. I hope I'm wrong. I hope that scientists and researchers have a miraculous breakthrough sooner. But the estimates that we are seeing are somewhere in the range of 12 to 18 months. Dr. New, do you have anything further?
Not really. I think you've said it very well, Minister Haidu. I think it's unprecedented what's been happening in the scientific world. It's been barely, I think, 2.5 months or so since the Chinese scientists first discovered the actual sort of cause of the unknown pneumonia at the time. It was a virus, and then actually published a genetic sequence. And since that time, it's been, the start line go, scientists around the world taking that and putting their best efforts forward. And I think it's not just Canada alone, obviously. I don't think, one country is going to, quote, figure out and deliver the vaccine on its own. It's really a global effort. People have seen that WHO announced that I think 30 or so vaccine candidates, there are various trials around the world, NIH, United States. It really is a global effort, and to the point that Canada can contribute to that in a coordinated fashion with other partners around the world. That's what we're all striving for. Similar to Minister Haidu, I think the estimates at the beginning were that for a vaccine it would take at least a good 12 to 18 months. But even now, with clinical trials starting now, a bare 2.5 months later, we're hopeful, optimistic. But we have to be realistic as well.
And just as a follow-up on that, I guess, like once we somewhere in the world sort of nails down a vaccine that works, how will Canada ensure that our citizens and that people around the world that need it actually have access to the medicine that can be effective against this virus?
So that's an excellent question. That's why we're investing so heavily in this space as well, because we need to be at the ground level of developing the vaccine and part of that global participation. And the more that countries share their knowledge and their research and their efforts, the more likely that it will be a shared solution, and the more likely it will be a shared vaccine as well. So that's why it's so critical that Canada is involved in the research and the science piece around both finding antidotes and looking for vaccine potentials. If we don't participate in that space, then we for sure would be left out, and that has been part of our consideration.
Thank you. Merci. Our next question is from Mélanie Marquis. La prochaine question est de Mélanie Marquis de La Presse.
Bonjour. Ma question est pour M. Champagne. D'abord, on commence à recevoir beaucoup de courriers de gens qui nous disent être pris au Mexique dans des destinations soleil comme Huatulco, Acapulco. Pouvez-vous juste nous faire le bilan de la situation là-bas? Aussi, parlant de rapatriement, Mme Bibeau, si vous pouviez préciser les pays d'où proviendraient les travailleurs saisonniers temporaires et à partir de quand est-ce que vous attendez aux premiers arrivages?
Alors, sur votre question pour le Mexique, pour vous donner une idée, on reçoit dans les derniers 48 heures environ 10 000 appels et 14 000 messages. Donc, quand je vous dis qu'on a des endroits dans le monde qui sont particulièrement chauds en termes de demande pour des services consulaires, évidemment, il faut comprendre qu'il y a des Canadiens un peu partout dans le monde. Ce que je peux vous dire présentement, c'est que comme il y a encore des vols commerciaux avec le Mexique, il semble que cette situation-là est encore sous contrôle. Parce que d'abord et avant tout, pour être clair avec les Canadiens et les Canadiennes, ce qu'on conseille, ce qu'on recommande, ce qu'on suggère, c'est évidemment que les gens, on a déjà émis l'avis de rentrer à la maison et c'est de regarder toutes les possibilités commerciales avec le ministre Garneau. Évidemment, on suit ça de très près pour assurer qu'il y a encore des vols commerciaux disponibles. Je pense que la situation au Mexique, il y a encore une capacité de vols commerciaux pour revenir. Mais comme je vous dis, Mme Marquis, cette situation-là, elle évolue d'heure en heure. Si on voit un problème particulier, bien évidemment, on sera là pour y répondre.
Pour ce qui est des travailleurs étrangers, ils viennent principalement du Mexique, du Guatemala, de la Jamaïque et quelques autres pays des Caraïbes. On s'attend que ça puisse commencer peut-être d'ici quelques semaines et je vous rappelle que ce sont des initiatives qui sont menées par l'industrie, donc par Ferme au Québec, Farm Canada. Alors vraiment, ce sont les représentants de l'industrie qui sont en charge de mener l'opération. Notre rôle est simplement, mais c'est pas si simple, d'obtenir les autorisations de voyage.
Merci. Minister Hajdu, if I may, I think I heard you say the Prime Minister is in talks and discussion with his counterparts in the provinces and territories. Was that about the closing the borders potentially? Was that what you meant? And if so, if they are talking about it, when can we expect a decision?
No, I should be clear. The Prime Minister is in constant contact with premiers, obviously, through this crisis, and many things have been discussed. I'm sure that how we move forward in containing the virus is one of them. What I meant to imply was that at all levels, we are in conversations with our counterparts. So I have a regular conversation with the Ministers of Health, at least weekly, most often bi-weekly. Also, Ministers of Health have my cell phone number, so I have many bilateral calls with Ministers of Health from various affected provinces and some that are not. And I know the Prime Minister is having those conversations as well. What I am hoping and what we are encouraging through the work that Dr. Tam and Dr. New are doing through the Public Health Officers Working Group is to make sure that we have a coordinated approach that is based on protecting citizens on the science of containment so that we not, as Dr. New mentioned earlier, cutting off our nose to spite our face, quite frankly. What we really want to do is make sure that the containment measures that we implement work and don't make things worse and don't interrupt supply chains domestically. So those conversations are ongoing. We are obviously very aware of the fact that we have some areas with extra vulnerability, whether it's northern communities and also areas that have extra activity in terms of the virus and its spread. Not every community is, even though it may have high numbers, in the same boat. For example, in Vancouver, they have a number of cases that are directly linked to 3 long-term care homes. Those are very specific situations. And so it's easy, I think, from the outside to say we should do this or put a wall around that, or we should, contain this particular area. But these decisions need to be driven through the best public health science, because what we want to do is take measures that are appropriate to the risk, that are going to protect the health and safety of Canadians, and not actually introduce new challenges or even worse conditions of virus spread that may be unanticipated if we act without using the science.
Thank you. Next question on the phone.
Thank you. The next question is from Maya Rapsod from the Canadian Press.
Hi, good morning. A question first for Minister Champagne, I believe.
I'm just curious. This morning, the Prime Minister said that people should not go to airports in foreign countries if they don't have a confirmed seat, but several airlines are telling people in these countries that they can't book online, they can't book on their phones because they're overloaded and they have to go to the airport. So they're getting a mixed message. I'm just wondering what you can say to them.
Well, the best advice I would say, as I said earlier, register with our website, because as you would appreciate, the situation is evolving country by country, sometimes regions within a country, and sometimes from airports to airports. So there's not one size fit all when it comes to that. I think the best possible thing, and I'll let Minister Garneau may want to add to that, but the best possible thing I would say is make sure you register, make sure you follow us and the embassies in particular jurisdictions, because these measures, even if I was to tell you what's the situation now, an hour from now, that may not be the case, because countries decide on the basis of their own health and safety of their citizens. So I would say, generally speaking, making sure that people have a booked flight is a good thing in terms of knowing whether it is worthwhile for you to go to the airport. But I would say, more generally speaking, make sure you are well informed. And one system that we have been putting in place is a system of text messaging in the phone of Canadians abroad in particular jurisdiction. That's also a very good source of information. When we're going to send planes in some jurisdictions, we will push out a message to Canadian abroad. That's probably the best thing. I would say keep your phone open and charged so that we make sure that we tell you well in advance, as we've done in Morocco. And I was just informed that our flight has landed in Casablanca and will take off in a couple of hours. That's kind of the model we're going to be following for other jurisdictions where we have a critical mass of Canadians to bring back home.
And I would just add that the approach that we're taking to flights such as the one that just landed in Casablanca is that those who want to catch that flight back from Casablanca do it online with Air Canada. That is by far the cleanest and simplest way to do it, and that is what we've been encouraging people to do.
Okay, and a question for Dr. New. I believe you said early on in this briefing that, quote, there is no doubt our efforts are making a difference, even though we may not be seeing them in the numbers right now. But can you maybe just reassure Canadians what you mean by that? I mean, a lot of people have stayed home this weekend and are wondering, is this actually doing something?
Well, as we've said, it remains to be seen, obviously, because even the cases that we see right now are actually a result of exposures or what happened to Canadians about up to 2 weeks ago. So by putting all the measures in, I think we're very appreciative of the great efforts Canadians are making. Is the fact that we're seeing the social distancing happening, in terms of how people are canceling play dates and making sure that if they do go outside for a walk, it really is sort of with the sort of the distance of 2 meters from others and so on. So that's what we're seeing right now in terms of Canadians taking up the challenge, I can call it, in terms of social distancing. And of course, we'll see, obviously, hopefully in a positive way, what the effects are a few weeks down the road. The other point also I'd like to stress, and I think Minister Champagne and others have already mentioned that, is that we need to pay special attention to the snowbirds that are coming back and people on cruise ships and so on. Obviously, from coming abroad, these people in other parts of the world may well have been exposed. So I think we need to remind them, reinforce the message that any returning Canadian coming to Canada has to go into self-isolation for 14 days.
And I will just say, I understand that people are frustrated and they're at home and they're not doing things that they normally do and they're not seeing their loved ones. But now is the time to double down, actually, because 1 week is not enough. We will start, as Dr. New indicated, to see if these efforts are making a difference in the next week to 2 weeks, and we'll report back. But that doesn't mean that the social distancing will be lifted. We will be in this situation for a while. And I think Canadians need to understand this isn't about 2 weeks of social distancing. This is about months of social distancing. And that's why Minister Morneau, in the last several days, made the announcement that he made about financial assistance for Canadians, understanding that there are going to be a tremendous amount of layoffs. This is going to be hard for us. This is going to be hard for us as a society. This is going to be hard for us financially. But I have every confidence that we will get through this together. And and that we will come back. We will bounce back, and that our communities will be stronger than ever. But now is not the time to take your foot off the social distancing measures.
Thank you. Next question on the phone as well, please.
Thank you. Merci. The next question, la prochaine question is from Philippe Vincent Foisy from Radio-Canada.
Première question sur les avions dans les pays. Comment vous allez choisir ceux qui rentrent au pays? Est-ce que c'est premier arrivé, premier servi? Est-ce que vous allez vous baser sur les facteurs les plus à risque? Les personnes les plus âgées vont pouvoir rentrer en premier? Est-ce qu'il y a un tri qui s'opère en ce moment ou qui va s'opérer dans les prochains jours? Vous avez une proportion de gens qui vont pouvoir rentrer et de gens qui ne pourront pas rentrer?
Alors oui, tout à fait. Il y a un certain tri qui se fait. C'est pour ça qu'on travaille avec Air Canada en particulier. On travaille aussi avec les ambassades et les consulats pour s'assurer que ce soit d'abord des voyageurs canadiens qui soient sur nos vols. Il y a aussi des gens qui pourraient être dans des situations vulnérables. C'est pour ça quand je dis que c'est important, ceux qui nous regardent à la maison, de s'enregistrer parce que ça permet d'évaluer les situations particulières auxquelles certains Canadiens et Canadiennes pourraient faire face. On a par exemple des élèves dans certains pays qui veulent rentrer au pays. On a des personnes qui ont besoin de soins médicaux particuliers, qui étaient à l'étranger pour une courte période et qui se trouvent présentement pris à l'étranger. Donc, la meilleure chose, c'est de contacter l'ambassade. Comme ça, oui, on est en train de, évidemment, garder des sièges sur ces appareils-là pour des situations particulières parce que c'est la chose intelligente à faire et la bonne chose à faire dans les circonstances. Je ne peux pas vous donner de proportions parce que la situation évolue de jour en jour parce que vous comprenez, c'est... Tant qu'il y aura des vols commerciaux dans une juridiction en particulier où les gens peuvent sortir, ça permet aux gens de rentrer comme ça. Nous, où on regarde présentement, c'est dans des endroits où, comme je le disais plus tôt, il y a des espaces aériens fermés, il y a des aéroports fermés, il y a des frontières qui sont fermées. Dans le fond, vous avez des gens pris sans avoir commis aucune faute. C'est-à-dire qu'ils veulent rentrer, mais il y a des circonstances exceptionnelles dans la juridiction où ils se trouvent qui leur empêchent de revenir sur des moyens commerciaux. Alors, il n'y a pas vraiment de proportion parce qu'on regarde ce qui se passe, mais ce que je peux vous dire présentement à l'heure qu'on se parle, c'est clair que le cas du Maroc, le cas du Pérou, le cas de l'Équateur aussi qu'on est en train de vérifier. Et à chaque fois, avec les autorités aériennes, avec le ministre Garneau, mes autres collègues, qu'on voit une situation se développer, on intervient d'abord pour faire débloquer la situation. Et cas échéant, si on n'est pas capable de la débloquer, on pense à d'autres solutions. Ce qui est clair pour les gens, c'est qu'on est en mode solution à toutes les étapes du processus pour permettre aux gens de rentrer au pays.
Et la capacité que vous avez, est-ce qu'on peut s'attendre à ce que une centaine de personnes rentrent au pays chaque jour? Est-ce qu'il y en ait des milliers après quelques jours? Donc, en termes de capacité, vous voyez le rapatriement se faire comment? Ceux qui sont malades, ceux qui ont la COVID-19 en ce moment à l'étranger, vous les laissez là dans certaines régions où les soins de santé ne sont pas parfaits, ne sont pas adéquats ou comparables, du moins aux nôtres.
Sur votre première question, en termes de chiffres, je pense qu'on parle plus au cours des prochains jours, des prochaines semaines, de milliers de personnes. Évidemment, ça va dépendre de voir comment on est capable d'avoir les autorisations d'atterrir, d'envoyer les appareils. Vous savez, souvent, c'est des appareils de grande capacité. On parle souvent des Boeing 777 avec ce qu'on appelle haute densité, donc 400 quelques passagers. Le ministre Garneau connaît mieux ça que moi, mais certainement, on a une grande capacité dans ces appareils-là. Sur votre autre question, je vous dirais la situation... C'est un peu semblable lorsqu'on a eu, vous vous rappelez, le Diamond Princess au Japon, où les gens ont dû être hospitalisés sur place. C'est clair que les gens, comme la ministre Trudeau le disait, la politique sanitaire qui s'applique est la même pour tout le monde, c'est-à-dire c'était le cas aussi lorsqu'on a vu les premiers cas, vous vous rappellerez à Wuhan, ce qu'on a vu au Japon, c'était dire que seulement les passagers qui étaient asymptomatiques, c'est-à-dire qui n'avaient pas de symptômes, pouvaient monter à bord parce qu'évidemment, on doit assurer la santé et sécurité de tout le monde, c'est-à-dire de ces gens-là, mais aussi des autres passagers qui pourraient être à l'intérieur de l'appareil et aussi, vous comprendrez, des membres d'équipage qui font un travail exceptionnel dans les circonstances. Donc, ceux qui devront rester sur place seront accompagnés avec notre personnel consulaire. On parle aussi, par exemple, avec la Croix-Rouge. On est vraiment en contact avec toutes les instances pour voir comment on peut mieux appuyer ces gens-là durant une période qui est particulièrement difficile.
Merci. Prochaine question.
Thank you. Next question.
Thank you. Our next question is from James Keller. Notre prochaine question est de James Keller from the Global Mail.
Hi there. I know Saskatchewan is threatening returning travelers with $2,000 fines. There's apparently been an arrest in Quebec from a COVID-19 patient who refused to self-isolate. So what do you think of using enforcement and fines and other penalties to enforce this public health advice? Do you think it's something that we require at the federal level? And what do you think of efforts sort of regionally and locally to do the same? This is probably a question for the health minister and Dr. New.
Well, thank you for the question. I was just surprised to hear the Saskatchewan detail. It was something I wasn't aware of. But I will say that each province and territory has their own quarantine act, which has significant penalties for violations of quarantines, and it's within their jurisdiction to apply those. The federal quarantine act also has those. These are very strong pieces of legislation that provide the various jurisdictions quite a bit of discretion in terms of how they will apply it and how they will assess the penalties. And so I can't comment on those specific cases clearly because I wasn't aware of them. But I will say that people need to know that we are saying self-isolate for 14 days, that it is a significant request, and in some cases it is mandatory depending on their jurisdiction and depending on their province's particular statements. Obviously, at the federal level, we have recommended strongly that people self-isolate. Should we see any sense that that is not happening, we will not hesitate to take stronger measures. At this particular time, though, we know that Canadians are by and large complying. We are actually looking at additional measures to make that crystal clear to returning Canadians and those who are coming off of cruise ships.
Yeah, and I'm going to say something that's kind of obvious, but the reason we ask people to self-isolate is to protect other people. That is the main reason. And even if a person may feel fine, the reason we ask them to self-isolate is to protect other people.
You get the sense, Dr. New, that there are people that aren't taking this seriously. I mean, we've all heard anecdotal stories of people who are, playing fast and loose with the rules or just ignoring them altogether.
Yeah, but just similar to what Minister Hajdu said, certainly from a public health perspective, I think all of our counterparts in the provinces and territories, we're all on the same page in terms of, exhorting the population, taking whatever means in terms of messaging and increasing awareness, informing people that it's the right thing to do in terms of social distancing. In terms of, stronger tools, be it legislations and so on, that's usually what we call a, measure of last resort. The Federal Quarantine Act really applies to, quote, our borders, the international borders, in terms of specific powers that the federal government has. But then within each province and territory, there are public health legislations that do permit public health authorities to take stronger actions as appropriate and necessary to protect public health. So that's all I can say. And the only thing I would add to that is that, people talk about social distancing as if it's a bad thing. And I want to also emphasize that, it's a physical thing. Social distancing, as a physical, tool, I call it, in terms of separating people to minimize possible transmission or further spread. That's not the same thing as social solidarity. And I really think that's one of the things we want to stress. Social solidarity is much more important than just sort of this tool of social distancing.
And I'll just add a final thought about that. I think Minister Garneau and Dr. New are completely right. We're asking people to self-isolate because it is to protect their family, their loved ones, their community from the potential of contracting this illness. And yes, the majority of these cases will be mild to moderate, but there are many people in our communities that will have a more severe expression of this disease, up to and including dying from it. And that's what we're all trying to do. And you cannot predict when you are symptomatic who it is that's going to die as a result of the work, the traveling around that you may choose to do. And finally, I will just say that when people are playing loose and hard with the rules like this, it does actually put our civil liberties at jeopardy. It makes governments have to look at more and more stringent measures to actually contain people in their own homes. So actually, our freedoms around the measures that we're taking right now depend on people taking them seriously, because politicians and governments will be pushed to a place to take more and more stringent measures when people violate them and don't take this seriously. So I would encourage Canadians to think about that and to think about their obligation to act collectively right now, Right now is your chance to act collectively. As Dr. Tam has been saying for days, the time is now for us to take action together.
Thank you, Minister. We'll take 3 last questions on the phone and we're going to wrap it up.
Thank you. Our next question is from Christian Noel. Notre prochaine question est de Christian Noel de Radio-Canada.
Bonjour, messieurs, mesdames les ministres. Ma question est sensiblement la même, mais en français. Pourquoi est-ce que les gens doivent prendre ça au sérieux maintenant? Et où est-ce qu'on pourrait se retrouver si jamais les gens ne respectent pas les règles que vous leur donnez?
Alors, l'idée vraiment, c'est on s'en tient encore, on a encore tout à fait confiance dans la rédaction des Canadiens. On voit à quel point les gens respectent la règle, ils comprennent que c'est important de rester à la maison parce qu'ils peuvent présenter une menace pour les gens qu'ils aiment. Donc, c'est pas juste comment nous, on se sent, mais c'est vraiment est-ce qu'on est à risque d'infecter sans savoir une personne qui pourrait être plus vulnérable. Et aussi longtemps que les gens vont collaborer, c'est ce que nous, comme gouvernement, on souhaite voir, évidemment. Si on s'aperçoit que de la négligence et que ça finit par poser un risque, c'est là qu'on peut être mis dans une situation où il faut prendre des décisions beaucoup plus contraignantes pour les citoyens et c'est pas ce qu'on souhaite. Alors vraiment, la collaboration des gens est extrêmement importante. Quand on revient de voyage, quand on présente des symptômes, il faut absolument s'isoler. Et de la même façon, il y a une solidarité qui doit aussi s'établir, une solidarité qui est sociale, virtuelle dans la mesure du possible. Mais j'en profite pour encore une fois remercier tous les travailleurs de la santé, tous les travailleurs du secteur agricole qui doivent aller au travail le matin tout en prenant plein de précautions pour se protéger, mais on a besoin qu'ils soient au travail pour fournir des soins et pour aussi nous nourrir.
To keep Canadians safe and to keep us fed.
But follow-up?
Thank you.
Okay.
No, our next question would be from David Akin. Notre prochaine question est de David Akin from Global News.
Good afternoon, ministers. Question for Minister Hajdu and then a quick one for Minister Champagne, and this will be all I have. For Minister Hajdu, we've got reports that some meatpacking plants in Montreal and southwestern Ontario could process more animals and are telling their producers, farmers, not to send them animals because there is a shortage of food inspectors from the CFIA. The reason there's a shortage, they're being told, is because of a previous existing, bureaucratic initiative from the CFIA to reduce the amount of overtime being paid to meat inspectors. I wonder if you've had a chance to review what the CFIA is doing to make sure they have enough people in plants. And the quick question for Minister Champagne, following up, I think, on something that the Prime Minister said, that around the world, as we're trying to get repatriated Canadians home, one of the issues is we need to have sort of a critical mass of Canadians in any one place to get on a flight or something like that. Is there a rough number of the, quote, critical mass of Canadians you might need in City A or Airport B in order to try to get people home? Minister Hajdu first, perhaps?
It's Minister Bibeau. We share this responsibility with CFIA, and I had a chance to have a good conversation with the President yesterday on this specific subject, on the capacity of CFIA to be in the field and have the inspectors doing their job. It's true that we have a challenging situation in terms of our human resources capacity right now. We are all humans, and some of our staff must be isolated as well. So right now, what we are doing is really to see where are the priorities amongst the priorities. We are collaborating with the industry to identify that. We are collaborating with the provinces as well to see how we can share some responsibilities, some personnel as well, where we can, just extend maybe some inspection for certain sector, but food safety will always be the top priority for CFIA, and we take it very seriously. So there's a challenge in terms of capacity, but we are working it out right now.
And David, to your next question, I think what we're doing is really return flight facilitation, because these people who are going to be boarding these planes, if they meet the health requirements, will have to pay also commercial fare to come home. And so I would say that we see in various hotspots, as we've called them, several hundred of Canadians who want to come home, but we will adjust with offer and demand. I mean, there's obviously in a number of places where we're looking a spike, and it's really based upon the challenges that people are experiencing. Because let me be clear to Canadians who are watching and those who are listening, there are still a number of commercial flights for Canadians to come back home. It might not be from their actual location to their scheduled destination, but people should be looking at ways to come back to Canada. What we're doing now is really to facilitate a number of flights where we have seen that countries have imposed a number of restrictions, which is making it extremely difficult for people who would be willing to come back to Canada, but are prevented from coming back to Canada just because the set of circumstances under which they're operating does not allow that. So yes, there are a number of hotspots because countries have not imposed the same amount of restrictions. Like I said, a number of airspace are still open, a number of airports are still open, a number of countries have maintained facilitation for people to cross and perhaps go in another country to take a flight back home. But we will certainly look at the hotspots and see the set of restrictions that are imposed. That's how we are looking at the situation, making sure that those which are the most vulnerable, we could help and bring back home.
Okay, I think we've answered all questions. So thank you, folks.